Enhancing Patient Safety in 2024, a C-Suite Perspective. Good morning, afternoon, and evening, everyone. I am Greg Wahlstrom, and it's a pleasure to welcome you to the Healthcare Executives presentation entitled Enhancing Patient Safety in 2024, a C-Suite Perspective. This presentation is designed to offer comprehensive strategies for healthcare leaders aimed at significantly improving patient safety within your organizations. Our focus today will be on exploring a variety of strategic approaches that address the critical challenges and opportunities in safety and patient safety as we face today, face problems today and anticipate them tomorrow. So we're going to dive into some important topics, the importance of leadership, the impact of technology, and the essence of essential practices that shape effective patient safety cultures within our healthcare settings. Given the complex and ever evolving landscape of healthcare, our goal is to equip you with the knowledge and the tools really that are necessary to lead and innovate in patient safety, ensuring that high standards are not only met but exceeded across all levels of your organization. So in just a moment, we'll move on to look at our agenda for today's session, which we will outline the key topics that we're going to cover. I'll encourage you to actively participate, asking questions and sharing insights as your experiences and perspectives are invaluable to make this a rich and constructive discussion. So thank you for joining us today, and I look forward to an engaging and informative session. So let's begin by reviewing our agenda to see how we will unfold the MyRIDS aspects of patient safety together. So let's talk about looking at the agenda for today's presentation. We have structured our session to cover several critical areas, each designed to enhance our understanding and strategies related to patient safety. So first, we'll start with an introduction where we'll explore the current landscape of patient safety, understanding its significance and the pivotal role it plays in our healthcare organizations. Next, we'll define patient safety, discussing its scope, the common challenges we face, and the consequences not adhering to high safety standards. This will set the foundation for the rest of our discussion. Following that, we'll dive into governance and patient safety, examining how governance models can be structured to prioritize and enhance safety. Our goal point will cover leadership and culture, focusing on how top management's approach and the organizational culture affects patient safety outcomes. And then we'll discuss the impact of technology advances in patient safety, highlighting how innovations are reshaping our approach to care and compliance. And in this section, we'll talk about data analytics, and we'll cover we'll also cover by looking at how big data and analytics play a critical role in predicting and preventing potential safety issues. Our discussion on compliance and regulatory frames will also provide insights into current regulations and how to manage and exceed these requirements. We will address risk management strategies, providing tools and examples on how to mitigate potential risk within patient care environments. Training and education will follow, emphasizing the need for continuous learning and adaptation to maintain and enhance safety standards. We'll then explore communication and patient safety, understanding the vital role that effective communication plays across different levels of healthcare teams. And then after that, the session will include detailed discussions on various practical areas such as monitoring and reporting of safety issues, engaging patients and families, and continuous improvement and innovation. So each of these points will explore into the specific strategies and actions and educational content necessary for you as C-suite leaders to implement and oversee. And finally, we'll conclude with a question and answer session where I'll invite all of you to ask questions or share insights related to the topics discussed. And this will give you an opportunity to clarify doubts, explore additional perspectives, or even discuss real world applications of strategies that are covered. And through this presentation, I'll encourage each of you to think about how these strategies can be implemented or improved within your organization. Your participation and interaction are key to the most out of today's session. So now let's move forward with our introduction to the topic and setting the stage for what promises to be a highly insightful and actionable discussion on enhancing patient safety. So thank you for joining us. And as we embark on this detailed exploration of patient safety, an important pillar of healthcare quality and management, today we're going to look inside and see why this topic demands our utmost attention and strategic thought. So as healthcare executives, you are already aware that patient safety transcends mere regulatory compliance, and it's a fundamental aspect of healthcare that directly impacts patient outcomes, institutional reputation, and operational efficiency. However, the landscape of patient safety is evolving rapidly, influenced by technology, regulatory changes, and patient expectations. In recent years, we've witnessed a significant transformation in how patient safety is managed. Advancements in technology and data analytics offer new opportunities to predict and prevent potential safety issues before they occur. Yet, with some of these advancements come new challenges and responsibilities. Our objectives today are threefold. To understand, we aim to deepen our understanding of the current patient safety landscape, including key challenges and opportunities. Number two, to strategize, we will explore strategic approaches that can be implemented at the executive level to enhance safety measures. And then three, we'll discuss on how to leverage innovation and technology to foster a culture of safety across your organizations, and the role leadership shapes a culture that prioritizes patient safety cannot be overstated. And as these leaders, your actions and decisions set the tone for the organizational priorities and practices, and it's about creating an environment where safety is embedded in every layer of the healthcare process, from the boardroom to the bedside. So having set the stage, let's proceed to define what it means by patient safety, and understanding its scope and the address the common challenges that impede our progress in this vital area. So with this framework in mind, let's move on to the next slide where we'll define patient safety, and then we'll explore its critical components. Defining patient safety, as we explore the specifics of patient safety, it's really critical that we start with a clear definition. So understanding exactly what it means by patient safety will guide our strategies and actions throughout this discussion. Patient safety is fundamentally about preventing and reducing risks and errors and also harm to patients during the provision of healthcare. So it involves a range of practices designed to protect patients from preventable injuries and to also improve the quality of healthcare delivery. So let's break down the critical components of patient safety. Number one, risk prevention, identifying potential hazards and implementing preventative measures to avoid harm. Number two, error reduction. So, streamlining processes to minimize the likelihood of mistakes. And three, mitigating harm mitigation. So, ensuring swift responses to any incidents that uh, to help minimize their impact on patient health. Quality improvement, continuously seeking ways to improve healthcare processes and outcomes. Five, regulatory compliance. So that's adhering to national and international standards and regulations that safeguard patient well being. Number six is patient engagement, involving patients in their care to enhance safety and ensure that their needs are met. Despite the straightforwardness of its definition, that the execution of patient safety is fraught with challenges, and these include complex healthcare systems, navigating multiple layers of healthcare delivery that can complicate safety measures, and technology integration, um, effectively incorporating new technologies without introducing new risks, human factors, managing the vulnerability or variability in human behavior and decisions making that can lead to errors. Resource allocation, ensuring adequate resources are available to support safety initiatives, which can be a significant challenge in resource constraints. Um, these consequences of not maintaining high standards of patient safety are severe, not just for the patients affected, but also the healthcare providers and the organization as a whole. And these consequences can range from loss of patient trust and satisfaction to financial losses due to lawsuits and regulatory fines, or more tragically, to loss of lives. Understanding these fundamentals helps us not only to comprehend the depth and breadth of patient safety, but also to identify where we as leaders can make impactful changes. As we move forward, we'll explore how governance structures can support and enhance these safety efforts. So now let's turn our attention to how governance and patient safety intersects and how effective governance models can significantly uplift our safety standards. Governance and patient safety. As we move forward in our discussion on patient safety, it's essential to understand the pivotal role that governance plays. And effective governance is not just about compliance. It's about creating a framework that actively promotes and sustains a culture of safety. So let's explain some of the key aspects of how governance can enhance patient safety in healthcare organizations. Enhancing clear safety standards. Governance structures must define uh, clear governance structures, achievable safety standards that are aligned with both national and international regulations. And these standards serve as the foundation upon which all safety measures are built. Resource allocation. A critical function of governance is ensuring that adequate resources, whether they're financial, human, and technological, are located towards safety initiatives. And this not only supports existing programs, but also it fosters innovation and safety practices. Accountability structures. Effective governance establishes clear lines of accountability, and this ensures that everyone in the organization understands their role in maintaining safety standards from the boardroom to the bedside. And monitoring and evaluation, governance must include robust mechanisms for monitoring safety outcomes and evaluating the effectiveness of safety protocols. This continuous feedback loop allows for timely adjustments and improvements. Transparency and communication. Governance should open or facilitate open communication and safe about safety issues within the organization, um, and also with external stakeholders. This transparency really builds trust and fosters a collaborative approach to improving patient safety. And as we talk about engaging leadership, leaders at all levels must be engaged and committed to the safety agenda. Governance should empower leaders to champion safety in their teams and departments. Uh, Learning and adaptation, governance frameworks should encourage a culture of learning where lessons from near misses and adverse events are analyzed and used to fortify safety measures. Patient and family involvement. Effective governance involves patients and their families in safety discussions and decisions, and this inclusion enhances perspective and reinforces the patient centered approach to care. Legal and ethical compliance. Governance ensures that all safety practices comply with legal and ethical standards, protecting the organization and its patients from legal repercussions and moral failings. Innovative practices. Finally, governance should foster an environment where innovation practices are explored and implemented, ensuring that organizations stay and at the forefront of patient safety. And these elements of governance are not just theoretical ideals, they're practical and actionable and strategies that can significantly improve the way that we manage and mitigate risk in our healthcare facilities. So, as leaders, your role in shaping and supporting this governance structure is really critical, and it's your strategic vision and steadfast commitment that will ultimately drive these principles into practice, creating a safer environment for both patients and healthcare providers. So now that we've established how governance interplays with patient safety, let's explore how leadership and organizational culture really underpins these efforts. So, moving on to the next slide, we'll explore the impact of leadership and culture on patient safety. Leadership and culture. Leadership is the cornerstone of any successful patient safety initiative. And so, as we turn our focus to how leadership and organizational culture can impact patient safety, it's important to recognize that the attitudes and behaviors of leaders set the tone for the entire organization. Let's explore how strategic leadership and a proactive safety culture can drive significant improvements in patient care. Modeling safety behaviors. Leaders must model safety behaviors they expect to see throughout the organization, and this includes adhering to protocols, participating in safety training, and openly discussing safety issues. Promoting transparency. A culture of transparency encouraged by leadership allows for open reporting and discussion of errors and near misses without fear of retribution. And so this is important for learning and improvement. Building trust. Trust within the healthcare team enhances collaboration and communication, which are vital for effective patient care. And leaders build trust by being approachable, fair, and consistent. Empowering staff. Leaders leaders should empower staff by providing them with the tools, training, and authority to act on safety concerns. Empowered staff are more likely to take proactive steps to ensure patient safety. Prioritizing safety and decision making. When leaders consistently prioritize patient safety and their decisions, it sends a clear message about the organization's values. And this might mean investing in better technology or more staff training, and fostering a learning environment. We want to be able to cultivate a learning environment, which means embracing mistakes as learning opportunities. And leaders should encourage staff to take their experiences and lessons learned from safety incidents. Encouraging engagement from every team member in safety initiatives is essential. Leadership should strive to make every employee feel like an integral part of the safety culture. Safety goals should be aligned with other organizational objectives, and incentives should be structured to promote safety outcomes such as bonuses for incident rates. And leaders must keep safety at the forefront of organizational priorities, continually reinforcing its importance through regular communications and updates. Leading by example. Ultimately, most powerful tool leaders have is leading by example. And so when leaders demonstrate a genuine commitment to safety, it creates a powerful ripple effect throughout the organization. These leadership behaviors and cultural attributes are not just idealistic goals, but they're also practical actions that can dramatically reduce errors and enhance patient outcomes. And by fostering a culture that values safety above all, we can protect our patients as well as our staff. As leaders in healthcare, you have the opportunity and responsibility to shape a culture that places patients' safety at its heart. And the decisions that you make and the priorities that you set, and the behaviors that you model will determine the level of safety within your organizations. So next, we're going to examine how technology advances are being leveraged to further enhance patient safety across our healthcare systems. Technology advances in patient safety. So as we continue to explore the elements critical to enhancing patient safety, we must discuss the transformative impact of technology. Innovations in healthcare technology are not just improving treatment outcomes, but they're also reshaping various landscapes of patient safety. So let's explore some of the key technological advances that are making a significant difference in how we protect and care for our patients. Electronic health records, EHRs. EHRs have revolutionized patient data management by ensuring that accurate and complete patient information is readily accessible. And this reduces errors and enhances decision making at the point of care. Telemedicine has expanded access to care, allowing for remote diagnostics and monitoring, which can prevent complications, and also reduce the need for emergency interventions. Artificial intelligence and machine learning, AI, and machine learning are being employed to predict patient risk, personalized treatments, and even identify potential safety issues before they occur. There's also wearable technologies that monitor vital signs in real time, providing continuous patient data that can be used to detect early signs of deterioration or improvement. There's also smart alarms, and these advanced systems reduce alarm fatigue among healthcare staff by filtering out alarms, false alarms, and highlighting critical ones, and ensuring that the attention is given where it's truly needed. There's also robotics in every surgery or in surgery. Robotics have led to more precise and less invasive procedures, which improve recovery times and reducing infection risks. Also, blockchain for health data security. So, blockchain technology is beginning to be used to secure patient data and prevent unauthorized access and to ensure the integrity of health records. Simulation and virtual reality. Um, Simulation and virtual reality are being used for training healthcare professionals, enhancing their skills in a risk free environment, and preparing them for real life emergencies. Clinical decision support systems, CDSS tools uh, are tools that provide healthcare professionals with knowledge and patient specific information, intelligently filtered or presented at appropriate times to enhance health and healthcare. There's also automated dispensing cabinets, and these systems manage medication storage and dispensing in hospitals, reducing errors in medication administration and improving patient safety. These technologies are not just standalone tools, but they represent an integrated approach to enhancing patient safety. By leveraging technology, we can create a safer healthcare environment that minimizes risk and maximizes patient care quality. And as leaders, your role in the adoption and integration of these technologies is imperative. It requires thoughtful planning, investment, and training to ensure that the benefits are fully realized without introducing new risks. And now that we've had have seen how technology is driving changes in patient safety, let's explore how we can harness the power of data analytics to further enhance our safety strategies. So, as we embrace technological advancements in healthcare, we can not overlook the transformative power of data analytics. Data driven insights are critical for advancing patient safety by enabling us to predict and prevent and also respond more effectively to potential safety issues. So let's explore how leveraging data analytics is essential in our ongoing commitment to patient safety. Predictive analytics, by analyzing patterns from vast amounts of data, predictive analytics can forecast potential safety events before they occur. And this allows us to intervene preemptively, enhancing patient outcomes. Real-time data monitoring. Utilizing real-time data streams for clinical settings enables continuous monitoring of patients' conditions, and this immediate insight helps in making timely decisions that can be critical to patient safety. Risk management. Data analytic tools assess risk levels across various parameters from patient health data to operational conditions, allowing healthcare facilities to allocate resources more effectively and mitigate risks. Analytics can compare performance across different units or against industry standards to identify areas for improvement in patient care and safety protocols. Root cause analysis in the event of a safety incident. Data analytics aids in conducting thorough root cause analysis to determine underlying issues, ensuring that corrective measures are both appropriate and effective. Advanced analytics helps in developing personalized care plans based on individual patient data, uh, improving safety and quality of care. Streamlining operations. Operational data analysis helps optimize workflow and reduce errors or delays that could compromise patient safety. Tracking and reporting safety incidents. Automated systems powered by data analytics can track incidents, analyze trends, and produce reports that help in understanding and addressing safety vulnerabilities. Staffing and training and development. Data analytics identifies training needs and effectiveness by evaluating performance data, ensuring staff are well prepared to uphold safety standards. Regulatory compliance and reporting. Analytic tools ensure compliance with healthcare regulations by providing proof of adherence to safety practices and facilitating accurate reporting to regulatory bodies. And these applications of data analytics not only enhance our ability to manage patient safety proactively, but also transform the very fabric of our healthcare delivery systems. And by integrating analytics into our safety strategies, we significantly evaluate our capabilities to protect patients. And as leaders in healthcare, your strategic oversight into the integration of data analytics into patient safety practices is imperative. And it's not only about adopting technology, but also fostering a culture that values data driven decision making. And having seen how the data analytics plays a critical role in enhancing our patient safety, let's now consider the compliance and regulatory framework that supports these efforts. So moving on to the next slide, we're going to explore how staying compliant not only meets legal requirements, but actively promotes a safer healthcare environment. So, as leaders, ensuring compliance with regulatory frames isn't just a legal obligation, but it's also a critical component of our commitment to patient safety. And today we'll explore how adherence to these regulations not only protects our patients, but also strengthens our healthcare systems. So let's dig into the key aspects of compliance and regulatory framework and how these impact patient safety. So, understanding current regulations, staying informed about the latest healthcare regulations is vital. It ensures that our practices are up to date and reflect the highest standards. Long term compliance strategies, developing these strategies that extend beyond immediate compliance requirements allow us to anticipate future trends and future changes and remain active in our approach to patient safety. Compliance should be seen as a cornerstone of patient safety, not just a legal requirement. It's about creating a safe and secure environment for both patients and staff. The most effective compliance programs are those integrated in the everyday workflows of healthcare staff. This integration helps to make compliance a natural part of our safety culture. Use of technology in compliance. Leveraging technology can streamline compliance processes from documentation to monitoring and reporting, and making it easier to maintain safety standards. Ongoing training and education on regulatory changes uh, is is really important within your organization, and they ensure that all staff are equipped to meet the compliance standards and understand their roles in promoting safety. Internal audits and monitoring. Regular audits and continuous monitoring are essential to ensure compliance, and to identify areas where improvements can be made. Engaging with regulatory bodies. Active engagement with regulatory bodies can provide insights into compliance expectations and foster a cooperative relationship that benefits patient safety. Understanding the consequences of non-compliance, from legal penalties due to the potential harm to patients, underscores the importance of adhering to regulatory frameworks. Sharing and adopting best practices within and across our healthcare organizations can elevate our overall compliance and safety standards. These regulatory frameworks are designed not to just enforce minimum standards, but also to drive continuous improvement in patient safety. By fully embracing these regulations, we can ensure that our healthcare facilities not only comply with the law, but also lead the way in patient safety excellence. And so, as we continue to navigate the complexities of healthcare regulations, our proactive and committed approach to compliance will serve as a benchmark for excellence in patient safety. So, let's carry this mindset forward, and as we consider the risk management strategies needed to further bolster our efforts. So next, we'll discuss on how implementing advanced risk management strategies can significantly enhance our ability to safeguard our patients. So risk management strategies. Effective risk management is pivotal in the realm of patient safety. It really is about anticipating potential issues before they occur and putting systems in place that mitigate those risks. So let's explore how strategic risk management can safeguard our patients and enhance the quality of care that we provide. Today we'll cover several risk strategies that embody our active approach to managing risks in healthcare settings. The first step in risk management is to conduct thorough risk assessments, and these assessments help us to identify potential safety hazards before they lead to harm. Preventative measures. Once risks are identified, implementing preventative measures is essential. This might include revising protocols, enhancing staff training, or upgrading equipment. Real-time monitoring. Utilizing technology to monitor patient conditions in real time allows us to detect and respond to changes swiftly, preventing adverse events. Incident reporting systems. A robust incident reporting system is essential for effective risk management, and these systems ensure that every potential safety issue is documented, analyzed, and addressed. Root cause analysis. When incidents do occur, performing a root cause analysis helps us to understand why and refine our processes to prevent reoccurrences. Continuous education. Ongoing education and training for all healthcare staff on the latest safety protocols and risk management strategies are vital to maintaining a safe environment. Patient involvement. Engaging patients in their own care process can significantly reduce risks. And educating them about their treatments and what safety measures they should expect can empower them and enhance safety. Quality improvement initiatives. Risk management is closely tied to quality improvement. So, regularly revising procedures based on new data and outcomes ensures continuous enhancement of safety standards. Crisis management planning. Having a clear, actionable crisis management plan is essential for handling unexpected events unexpected events effectively and really trying to minimize their impact on patient safety. Safety and culture. Finally, fostering a culture that prioritizes safety above all else ensures that everyone from the top down is committed to mitigating risks. And these strategies, they highlight the importance of a comprehensive and proactive approach to risk management in healthcare. And by implementing these measures and procedures, we not only prevent harm, but we also build a foundation of trust with our patients and their families. As leaders, your commitment to driving these risk management strategies forward uh, is crucial. It's a more than protocols and procedures. It's about really creating a culture where patient safety is a cornerstone of everything that we do. And so now that we've discussed how to manage risks effectively, let's move on to discuss the specific areas in clinical practice where we can apply these risk management principles to enhance patient safety. Patient safety and clinical practices. Having established a broad understanding of risk management, it's important to narrow our focus and apply these principles directly to clinical practices. And this is where our strategies meet the front lines of healthcare, impacting patients' lives directly. Let's discuss how we can implement targeted risk management strategies within clinical areas to significantly enhance patient safety. Medication safety. Ensuring the safety of medication administration is paramount, and this includes using barcoding technology, implementing double-checked systems, and training staff on the latest medication management protocols. Surgical safety and surgical settings, risk management involves strict adherence to safety checklists, preoperative planning, and postoperative care protocols to minimize complications and infections. Emergency care. In emergency departments, rapid response and accuracy are crucial. So, streamlining triage processes and enhancing communication can significantly reduce treatment delays and errors. Infection control. Maintaining rigorous infection control practices is essential, especially in high risk areas like the ICUs and surgical wards. Regular staff training and adherence to sanitation protocols are key. For patients with chronic conditions, ongoing monitoring and proactive management can prevent exacerbations and complications, and using digital health tools can improve continuity of care. Obstetrics and neonatal care, and these are sensitive areas. Risk management includes monitoring during labor and delivery, proper neonatal care, and maternal support post birth to ensure safety of both the mother and child. And so, radiology and imaging, they reduce exposure to radiation and ensure accurate diagnostics, which is important. Implementing safety standards and continuous staff education and radiology practices can mitigate potential risks. Also, mental health services. Providing safe mental health care requires ensuring patients and staff safely through ensuring patient and staff safely through environmental designs and crisis intervention training and support systems for at-risk patients. Training staff is and safe patient handling techniques reduce the risk of injury to both patients and healthcare workers. And this includes proper use of lifting equipment and ergonomic training. Outpatient care. For outpatient care settings, risk management focuses on accurate patient assessment, timely follow ups, and ensuring patients understand their treatment plans to prevent readmissions. And these targeted strategies across various clinical areas highlight our comprehensive approach to risk management and patient safety. And by focusing on these specifics, we can effectively address how potential risks that are unique to each clinical setting. And as leaders in healthcare, your role in overseeing and advocating for these practices are important. And it's up to us to ensure that these risk management strategies are not only understood, but diligently applied across all levels of our organization. Moving forward, let's explore how communication plays a vital role in success of these safety initiatives. So, effective communication not only supports risk management, but it's a fundamental component of fostering a safe culture. Communication strategies and patient safety. Effective communication is fundamental to patient safety, and it really underpins every aspect of healthcare, from the handover of patient information to daily interactions between staff and patients. So today we will explore how strategic communication practices can significantly enhance safety across all levels of our healthcare organizations. So let's dive into key communication strategies that foster a culture of safety and ensure that every team member is informed, engaged, and responsive. So let's talk about standardizing communication protocols. Implementing standard tools such as the SBAR, situation, background, assessment, and recommendation to ensure clarity and consistency in information exchange across all care settings. Training on effective communication. Provide regular training for all healthcare staff on effective communication techniques, emphasizing the importance of clear, concise, and respectful interactions. Utilizing technology to aid communication. So, leveraging technology platforms like electronic health records and mobile communication tools to ensure that accurate patient information is readily accessible and communicated in real time. Promoting open dialogue. Encourage an environment where staff feel comfortable voicing their concerns and suggestions without fear of retribution. So this open dialogue is important for identifying and addressing potential safety issues promptly. Improving handoff procedures, enhancing the safety of patient handoffs between shifts and departments by implementing comprehensive checklists and requiring verbal confirmation of key information. Enabling patients and families, or engaging patients and families. Actively involving patients and their families in safety discussions. Educate them on their treatments and care processes to ensure that they understand and can advocate for their safety. Um, Crisis communication planning. Develop clear communication plans for potential crises or safety incidents. Ensure that all staff know that their roles and responsibilities during these critical times, and feedback mechanisms. Establish robust mechanisms for feedback on communication effectiveness, both from staff and patients. So use this feedback continually to improve communication strategies. Language and cultural considerations. Adapt communication approaches to meet the diverse linguistic and culture needs of the patient population. So, this includes providing translation services and culturally sensitive communication training, documentation practices, maintaining rigorous documentation practices that ensure patient interaction and decisions are recorded accurately. This not only aids in the continuity of care, but also serves as a critical tool in incident investigations. So these communication strategies are not just about transmitting information, but they're also about creating interconnected environments where everybody's voice is heard and concern is addressed. And this is essential for fostering a proactive safety culture. So, as leaders, it's imperative that we champion these communication strategies, and we must lead by example, demonstrating effective communication and ensuring that our teams are trained and equipped, communicate efficiently and respectfully. With a strong foundation in communication, we are better equipped to handle the complexities of patient care safety um, and effectiveness. And so now let's turn our attention to training and education. Essential components for empowering our teams to uphold the highest standards of patient safety. Training and education. Training and education are cornerstone practices in any patient safety strategy, and they empower our healthcare professionals with the knowledge and skills needed to perform their roles effectively and safely. And today we'll discuss how to implement robust training and education programs that directly contribute to improving patient safety. So let's explore the essential elements of effective training and communication, uh, uh, or effective training and education programs that support safety across our healthcare systems. Customized training programs are developed train uh, developed tailored training programs that address specific needs of different departments and roles within the healthcare setting. And this ensures that every team member is equipped with relevant skills to manage their safety and their specific area of work. Simulation based learning, utilizing simulation tools to create realistic scenarios where staff can practice and refine their skills in a risk free environment. And this type of training is particularly effective for improving decision making and procedural skills in critical care situations. Continuous professional development, encouraging ongoing professional development for all healthcare workers. This includes regular updates on the latest patient safety research, innovations in healthcare, and changes in safety regulations. Interdisciplinary training, promoting as interdisciplinary training sessions where teams from different specialties come together and learn from each other's experiences and insights. And this enhances collaboration and improves understanding across various departments. Patient safety workshops, organizing regular workshops focuses on key patient safety topics such as infection control, medication management, and emergency response. And these workshops can help reinforce a culture of safety and vigilance. Incorporating feedback mechanisms into training programs can continually adjust uh, and improve the content and the delivery methods based on staff input and involving staff safety needs. Leadership training to ensure that leaders at all levels receive training not only on safety practices but also on how to effectively promote and lead safety initiatives within their teams. As we talk about compliance education, educate all staff about the legal and ethical implications of patient safety, ensuring that they understand their responsibilities under current healthcare laws and standards. Technology and safety training, new technologies are adopted within the healthcare environment, provide specific training on how these tools can be used to enhance patient safety. Mental health and well being programs recognize the role of mental health in overall patient safety by providing programs that support the psychological well being of healthcare providers. A well supported staff is more likely to maintain high standards of patient care, and these training and education initiatives are really important for building a knowledgeable and prepared workforce that can confidently handle both routine care and complex safety challenges. And so, as leaders, it is our responsibility to ensure that training and education are not just treated as periodical exercises, but also are embedded into the fabric of our organizational culture. By investing in comprehensive and continuous training, we reinforce our commitment to patient safety at every level. And with a well-trained and continuously educated workforce, we can maintain better, or we can better manage the risks and the challenges inherited in healthcare. And so, next, I want to look at how monitoring and reporting of safety incidents and how they play a critical role in our ongoing safety efforts. So, monitoring and reporting of safety incidents is effective monitoring and reporting systems are important components of a robust patient safety strategy. And they not only help us identify and address current safety issues, but also provide the data needed to prevent future incidents. So let's explore how these systems can be optimized to enhance patient safety across healthcare facilities. So today we're going to discuss key aspects of incident monitoring and reporting that every healthcare organization should implement. So comprehensive incident reporting systems establish a comprehensive incident reporting system that is easy to use and accessible to all staff members. And this system should encourage reporting of all incidents, so including near misses or without fear of blame or retribution. Real-time monitoring, utilizing real-time monitoring technologies to track critical patient vitals and care processes. And these systems can alert staff to potential issues before they escalate into serious issues. Data analysis and prevention, regularly analyzing the data collected from incident reports and monitoring systems to identify patterns and trends that could indicate underlying systematic problems. And this analysis is crucial for proactive risk management. Transparency and reporting, maintaining transparency with all staff about outcomes and learnings from reported incidents. And this openness promotes a culture of continuous improvement and trust. As we look at training on reporting procedures, providing ongoing training for all healthcare personnel on the importance of incident reporting and the correct procedures to follow. Ensuring everyone understands how to report an incident is fundamental to capturing accurate and useful data. Feedback loops. Implement feedback loops to ensure the information gleaned from incident reports is used to update training, protocols, and systems. This closes the loop between identifying safety issues and resolving them. Accountability and follow up. Establishing clear accountability structures for following up on reporting incidents. This includes investigating incidents, implementing corrective actions, and monitoring the effectiveness of those actions. Engagement with stakeholders. As we engage a wide range of stakeholders, including patients and families in the development and redefine and refinement of monitoring and reporting systems, and their insights can provide valuable perspectives on safety concerns and potential improvements. Regular safety audits. Conducting regular safety audits to assess the effectiveness of the monitoring and reporting systems and ensure compliance with internal safety standards and external regulatory requirements. Leadership involvement. Ensuring active leadership involvement in the review and management of safety incidents. Leadership's direct engagement demonstrates a commitment to safety and can drive more effective solutions. These strategies for monitoring and reporting are not just about compliance or record keeping. They are vital for building a safer healthcare environment where every incident is seen as an opportunity to learn and improve. As leaders, your advocacy and support for robust monitoring and reporting systems are imperative. By fostering an environment where safety incidents are openly discussed and addressed, we can significantly enhance the overall safety culture within our organizations. And with a strong system for monitoring and reporting in place, we can ensure that our efforts in patient safety are continuously informed by reliable data. Next, we'll discuss how engaging patients and their families in our safety processes not only enhance care, but also builds trust and improves outcomes. Engaging patients and families. An essential component of enhancing patient safety involves actively engaging in patients and their families in the healthcare process. This collaborative approach not only empowers patients, but also leverages their unique insights and experiences to improve safety outcomes. So today we'll discuss strategies to effectively involve patients and their families in our safety initiatives. So let's explore how approaches to enhance patient and family engagement in our healthcare settings. So open communication channels. Establish open and clear communication channels that encourage patients and their families to ask questions and express concerns and provide feedback about their care experience. Create councils that include patient and family members as advisors to provide perspectives on safety practices, policy developments, and care improvements. Education programs, offering comprehensive educational programs that inform patients and families about their conditions, treatment options, and safety measures. Knowledge is a powerful tool for safety. As we talk about inclusion and care planning, actively involve patients and their families in the planning and decision-making process of their care. This inclusion fosters a sense of ownership and responsibility for outcomes. Transparency in care processes. Maintain transparency by openly sharing information about procedures, risks, and safety protocols with patients and their families. Feedback mechanisms. Implement robust mechanisms for collecting and responding to feedback from patients and families. Use this feedback to drive continuous improvement and safety practices. Support for patient advocacy. Encourage the use of patient advocates who can act as intermediaries between healthcare providers and patients, ensuring that patients' voices are heard and considered. Cultural competence training. Provide training for healthcare staff on cultural competence to understand and respect diverse patient backgrounds and perspectives, which is crucial for effective engagement. Safety oriented sessions. Conduct safety oriented sessions for patients and families upon admission to inform them of the safety measures in place and how they can contribute to a safe care environment. Develop recognition programs that honor patients and families who contribute significantly to the safety improvements. This not only rewards effort, but also promotes a culture of safety among patients and staff alike. So, by implementing these strategies, we can create an environment where patients and their families are not just recipients of care, but also active partners in ensuring safety. And this partnership is crucial for building a resilient healthcare system. And as leaders, fostering this environment of collaboration and respect with patients and their families is the key to our success and patient safety. And it's our duty to ensure that they are equipped and empowered and encouraged to participate actively in our safety efforts. So, empowered patients and families are invaluable allies in our ongoing quest to enhance patient safety. And as we continue our discussion, let's focus on how we can drive continuous improvement in our practices to further solidify our commitment to safety. Continuous improvement and innovation. Continuous improvement and innovation are not just buzzwords in healthcare, but they're essential practices that drive our industry forward, and particularly in the realm of patient safety. Today, we're going to explore how we can foster a culture of continuous improvement and encourage innovation to enhance the safety and quality of care we provide. So, let's examine strategies that help us build a proactive, safety first culture through continuous improvement and innovation. Cultivate learning culture, encouraging a culture that views mistakes and incidents as learning opportunities. Foster an environment where staff are motivated to share insights and learn from each other without fear of blame. Implement quality improvement cycles. Utilize quality improvement cycles such as do, plan, study, act, the PDSA, to test changes on a small scale, evaluate results, and redefine processes before fully implementation. Leverage technology for safety environments. Continuously assess and integrate new technologies that improve patient safety outcomes, such as advanced monitoring systems or AI driven diagnostic tools. Regular safety audits and assessments. Conduct regular safety audits to assess current practices and identify areas for improvement. Use these findings to make informed adjustments to safety protocols. Interdisciplinary collaboration. Promote collaboration across varied disciplines within the healthcare facility to foster diverse perspectives in solving safety issues and improving patient care. Encourage staff engagement and ownership. Empower staff members by involving them in safety issues and decision making processes. Ownership of safety processes increases commitment and motivation. Invest in staff training and development. provide ongoing training and professional development opportunities to ensure that all staff members are up to date with the latest safety practices and technologies. Monitor and measure performance. So, use performance metrics to monitor the effectiveness of safety issues. Regularly review these metrics to track progress and identify these areas needing additional focus. As we look at fostering open innovation, create platforms where staff and staff can have the opportunity to suggest innovative ideas for improving patient safety and consider initiatives like hackathons or innovation labs that encourage creative problem solving. So, as we look at evaluating and adapting best practices, stay informed about industry best practices and benchmarks against top performing institutions. Adapt to these practices to fit the unique needs of your organization. And by integrating these strategies into our everyday operations, we not only enhance our ability to prevent and respond to safety incidents, but also create a dynamic environment where excellence in patient safety is continually pursued. So, as leaders, it is our responsibility to drive these initiatives forward and ensuring that our organizations are not only keeping pace with the current standards, but are also at the forefront of innovation and patient safety. So let's commit to a future where continuous improvement and innovation are at the heart of what we do. And having established a foundation for continuous improvement, let's move forward to discuss specific risk management techniques and different clinical areas, ensuring that our commitment to safety translates into every aspect of patient care. And so now let's talk about preparing for the future. As we continue to navigate the complexities of healthcare, and preparing for the future becomes crucial, and especially in the realm of patient safety. So today, let's discuss strategies to not only respond to emerging challenges, but also to anticipate them. Ensuring that our healthcare systems are resilient and adaptive and forward thinking, let's examine the essential approaches to future proofing of our patient safety efforts in a rapidly evolving healthcare landscape. So, adaptive predictive analytics, utilizing predictive analytics to forecast potential safety issues based on historical data and trends. This proactive approach allows us to take corrective measures before incidents occur. And so, investigating emerging technologies and staying abreast of and investing in emerging technologies that have the potential to transform patient safety, such as genomic medicine or personalized healthcare and advanced robotics, enhancing disaster preparedness. Strengthening our disaster preparedness and emergency response strategies to handle crises effectively, whether they are natural disasters or pandemics or technological failures. As we talk about promoting sustainability in healthcare, integrate sustainability practices into patient safety programs, ensuring that our safety solutions are viable long term and do not deplete resources or cause harm to the environment. Cultivating a culture of continuous learning, encouraging a culture of continuous learning and adaptation among all healthcare staff, fostering an environment where staff are informed and agile is a priority. And legislative awareness and advocacy, keeping up to date with legislative changes affecting healthcare and engage advocacy to influence policies that impact patient safety positively. As we talk about global collaboration, it's essential to enhance collaboration with global health communities to ensure knowledge and learn from international best practices and respond to global threats collaboratively. As we talk about building resilient healthcare infrastructures, We're talking about focusing on creating resilient healthcare infrastructures that can adapt to changes in the healthcare environment without compromising patient safety. Focusing on mental health and well being, addressing the mental health and well being of healthcare workers is a critical component of patient safety, and recognizing that a supported healthcare team is important for maintaining high safety standards. Talking about scenario planning and employing scenario planning um, is to envision possible future challenges and to develop strategic responses. And this helps ensure that our systems are robust and flexible enough to handle unexpected situations. And so these strategies are not just about reacting to change, but also being steps ahead. By anticipating future trends and challenges, we can ensure that our patient safety measures are not only effective today, but will remain so in the future. And so, as leaders, your vision and proactive efforts are key to driving these future oriented strategies. And so, let's commit to a future where our healthcare system are as dynamic and resilient as the communities that we serve. And so together we can build a safer environment for everyone now and in the future. And with our eyes on the future, we can now turn to examine how we can apply these concepts to specific clinical areas, ensuring that our commitment to innovation and patient safety is embedded throughout our organizations. Safety leadership development. Safety leadership is not just about managing processes, it's about inspiring and cultivating a culture where safety is the priority at every level. And so today we'll look into the essential strategies for developing strong safety leaders within our healthcare organization. So let's explore how we can foster leadership qualities that enhance our capability to maintain high standards and patient safety. So, emphasizing safety and leadership training, integrate patient safety as a core component of all leadership development programs. And leaders must understand that their pivotal role in setting safety priorities and modeling safety behaviors. Mentorship programs, we want to establish mentorship programs that pair less experienced leaders with seasoned mentors who can have a strong track record in safety leadership. Mentorship is a powerful tool for passing on knowledge and reinforcing culture of safety. As we look at leadership accountability, implement clear accountability mechanisms for safety outcomes. Leaders should know that they're not only responsible for achieving business strategies, but also for maintaining and improving patient safety standards. So, encouraging open communication is essential, and training leaders to promote open lines of communication about safety issues. These should make it easier for staff to come forward with safety concerns and suggestions without fear of retribution. Decision-making autonomy, empowering leaders with autonomy to make critical decisions regarding patient safety. This empowerment helps instill a sense of responsibility and urgency when safety risks arise. Regular safety reviews involves leaders in regular safety performance reviews and strategy sessions. And so these reviews should be constructed and focused on continuous improvement, not just compliance. So, as we celebrate safety achievements, recognizing and celebrating leaders who make significant contributions to patient safety. Recognition can serve as a powerful motivator for leaders to prioritize safety in their operations. Incorporating safety into strategic planning. Ensuring that patient safety is an integral part of strategic planning at the executive level. Leaders should align organizational goals with safety objectives. Crisis management skills. Providing leaders with training in crisis management. Effective handling of a crisis can prevent a serious safety event from becoming a disaster. And so
let's talk about building resilient teams. Supporting leaders and building resilient teams that can adapt to a recovery from safety challenges. And resilience training should include skills in stress management, teamwork, and problem solving. Effective safety leadership is transformative, and by developing leaders who are not only competent in their clinical and administrative roles, but are also passionate advocates for patient safety, we amplify our efforts to protect those under our care. And as senior leaders, your commitment to nurturing the next generation of safety leaders is critical. So let's equip them with the best skills, knowledge, and mindset needed to drive our culture forward. So, this is how we can ensure that patient safety continues to evolve and improve. With a strong leadership foundation in place, we now turn our attention to the legal and ethical considerations that impact patient safety. It's important that our safety leaders are prepared to navigate these complexities effectively. And so now let's talk about legal and ethical considerations. Patient safety is not only a clinical priority, but also a legal and ethical imperative. Today, we'll explore the essential legal and ethical considerations that underpin our efforts to ensure patient safety. Ensuring that practices not only meet clinical standards, but also uphold the highest ethical and legal principles. So let's explore the key aspects of legal and ethical considerations that healthcare leaders should be vigilant about. Understanding healthcare law, maintaining an up to date understanding of healthcare law and regulations that impact patient safety. And this includes laws related to medical malpractice, patient privacy, and consent. Ethical decision making, promoting ethical decision making in all aspects of patient care, and this involves training staff to handle ethical dilemmas that they may encounter, ensuring decisions priorities prioritizes patients' well-being, informed consent, ensuring that informed consent is obtained from all patients before any procedures or treatments, and this is not only a legal requirement, but also a fundamental ethical practice to respect patients' autonomy. And so, as we talk about transparency with patients, adopting a policy of openness and honesty and communicating with patients, especially when things go wrong, transparency is crucial for maintaining trust and accountability. As we engage in protecting patient advocacy, uphold stringent standards for patient privacy and confidentiality, which are mandated by laws such as HIPAA in the United States, and ensure that all staff are trained and compliant with these regulations. Conduct regular audits to ensure compliance with all applicable laws and regulations, and help identify potential legal vulnerabilities and mitigate risk before they lead to litigation. Addressing malpractice risks, implement risk management strategies to reduce the likelihood of malpractice claims. This includes maintaining thorough documentation, following clinical guidelines, and continuous staff training. Ethical training programs, develop and maintain robust ethical training programs that cover key topics such as end of life care, patient rights, and conflict of interest scenarios. Reporting and accountability mechanisms, establish clear mechanisms for reporting ethical and legal concerns internally. Ensure that there are no repercussions for staff who report these issues in good faith. Leadership and ethics and compliance, as leaders embody and promote a culture that values ethics and compliance just as a high just as highly as clinical outcomes. So lead by example in all legal and ethical manners. These legal and ethical considerations form the backbone of our commitment to patient safety. And, by adhering to these principles, we are not only protecting our patients, but also building a stronger and more trustworthy healthcare system. And it's imperative that we as leaders stay vigilant and proactive in navigating these legal and ethical landscapes. So let's continue to foster an environment where safety, legality, and ethics converge to protect and enhance the lives of those we serve. Having established a strong foundation in legal and ethical practices, let's move forward to examine how global health policies can impact our local practices and how we can effectively integrate these into our safety protocols. So, impact of global health policies on local practices. In today's interconnected world, global health policies significantly influence local healthcare practices, and especially in terms of patient safety. So, understanding these influence and integrating global insights into local practices are important for enhancing our healthcare system. So let's discuss how we can effectively navigate and leverage these global policies. Here are some of the key strategies effectively integrated into global health policies and our local safety protocols. So, staying informed about global standards, we want to keep abreast of international health policies and standards, such as those from the World Health Organization, WAA, or WHO. Understanding these can help us anticipate changes and align our local practices with global best practices. And adopting international safety protocols, as we evaluate and adopt international safety protocols that may have been proven effective globally, this could involve practices related to infection control, surgical safety, and patient handling. Participating in global health networks, engaging with global health networks and forums to exchange knowledge and learn from the experience of healthcare systems in other countries. This collaboration can provide insights and enhance our local practices. Benchmarking against international standards, using international benchmarks to measure the effectiveness of our patient safety initiatives. This benchmarking can motivate improvements and help achieve high standards of care. Talking about adapting global policies to local context, while adopting global policies, tailor them to fit the specific culture, economic, and regulatory context of our local healthcare environments to ensure that they're effective and applicable. Training and capacity building, train healthcare staff on international best practices and the importance of global health policy compliance. This ensures that our teams are skilled and knowledgeable about the latest global developments in patient safety. And also utilizing technology to keep pace with global trends in patient safety. This includes adopting advanced technologies that have been effective in other countries, such as telemedicine and AI-driven diagnostics. Responding to global emergencies, developing protocols for responding to global health emergencies, such as pandemics or international health alerts, based on specific global responses. Talking about promoting health equity, integrating principles on health equity promoted by global organizations into local practices to ensure that all patients receive safe and equitable care. Advocating for policy changes as act as advocates for the adaptation of global health policies that benefit patient safety at the local and national levels. Use this evidence from international practices to support policy changes. By integrating these global insights into our local practices, we not only enhance patient safety, but also contribute to the global effort to improve healthcare outcomes. And this approach ensures that we are not working in isolation, but also part of the larger global community. So, as leaders in healthcare, it's our responsibility to bridge the gap between global innovations and local implementations. And so, let's take proactive steps to ensure that our healthcare systems are globally informed and locally effective. And so, having explored the global impact on local practices, let's consider specific safety protocols across various clinical areas to ensure that we are implementing the most effective and comprehensive safety measures. So as we gear our discussion, let's talk about implementing patient safety technologies. And as we continue our journey to enhance patient safety, let's focus on the implementation of cutting edge technologies. These tools not only streamline healthcare processes, but also significantly improve the safety and quality of care we provide. And so today we're going to explore practical steps for successfully integrating innovative technologies into our patient strategies. And how we can effectively deploy these technologies across our healthcare system. So, technology assessment and selection. Begin by assessing the specific needs of our healthcare settings and selecting technologies that address these needs most effectively. And so, this may include software for electronic health records, real time monitoring systems, or AI driven predictive tools. Also, piloting testing. Before full-scale implementation, conduct pilot tests of new technologies in small controlled settings. This allows us to evaluate their effectiveness and make necessary adjustments without disrupting the entire system. Also, staff training. Ensure that all healthcare providers are thoroughly trained on how to use the technologies, and training should be comprehensive, covering not only how to operate the technology, but also how to integrate it into the daily clinical practices. And so, talking about integration with existing systems, seamlessly integrate new technologies with existing IT systems. This really requires careful planning to ensure capability and interoperability between different systems to avoid silos of information. So, patient engagement tools, we want to look at implement patient facing technologies that enhance patient engagement and safety. And this can include patient portals that provide access to personal health records, appointment scheduling, or medication management. Data security measures. With the adoption of the new technologies, ensuring robust data security measures are in place to protect patients' information from breaches. And this includes encryption, secure data storage, and regular security audits. As we talk about continuous monitoring and feedback, once implemented, continuous monitoring the performance of these technologies to ensure that they're functioning as intended, gather feedback from users to identify any issues or areas for improvement. Regulatory compliance, stay informed about and comply with regulatory requirements related to new technologies, including those concerning patient privacy and data protection. Scalability and sustainability. Consider the scalability and sustainability of technologies. Plan for future growth and potential technology advancement to ensure that the investments remain viable in the long term. So, as we talk about outcome measurement, measuring the outcomes of implementing these technologies by tracking performance indicators related to patient safety, such as error rates, patient satisfaction, and overall efficiency improvements. By thoughtfully implementing these patient safety technologies, we not only enhance our capability to care effectively, but also position our healthcare systems at the forefront of innovation and safety. This proactive approach really ensures that we are always improving and adapting the needs of the patients that we serve. And so, as leaders, your role in championing and overseeing the adoption of these technologies is critical. And so, let's embrace these advancements not just as tools, but also integral components of our ongoing commitment to excellence and patient safety. So, with our technology strategies in place, let's look ahead to see how we can utilize data analytics to continuously redefine and improve the safety measures. So, talking about analyzing safety data effectively, data is a powerful tool in the pursuit of patient safety. And it's not only helps us to understand where we stand, but it also guides us towards where we need to go. And so effective data analysis is crucial for uncovering insights that can lead to improved safety outcomes. And so today we'll explore how to effectively analyze safety data to enhance patient care and safety protocols. And so now let's examine the essential techniques and tools making the most of data that we collect and ascertain. Data collection standards ensure that data collection across all points of care adheres to high standards of accuracy and consistency. This really allows using standardized data formats and ensuring that all staff are trained in precise data entry. Advanced analytical tools utilize advanced analytical tools that can handle large data sets and complex analysis. Tools like predictive analytics software and machine learning algorithms can identify patterns and predict safety issues before they occur. Real-time real-time data analysis, implementing systems that provide real-time data analysis allows for immediate responses to emerging safety concerns. So this can significantly reduce response times and prevent harm. And so as we look at visualization techniques, using data visualizing tools to create intuitive and clear presentations of safety data, visualizations like dashboards and heat maps can help staff quickly understand and act on this information. And so comparative analysis, we regularly perform comparative analysis to benchmark your safety metrics against industry standards or past performance. And so this can help identify areas where your practice may lag and need improvement. As we look at feedback loops, establish feedback loops that use data analysis results to inform and adjust patient safety protocols. And this ensures that safety measures are continually redefining based on empirical evidence. And so cross-departmental data sharing really helps to facilitate cross-departmental sharing of safety data to ensure that all relevant parts of the organization can learn from and act on this information. And so this encourages a unified approach to patient safety. Talking about staff engagement and training, engage and train staff to understand and use data analytics in their daily work. Empowering staff with data literacy really helps to enhance their ability to contribute to safety improvements. So as we look at risk management integration, integrating risk management strategies with data analysis to prioritize and tackle the most critical safety issues identified through data trends and continuous improvement. We use data analysis not just for reactive measures, but also for continuous improvement and regularly updating safety protocols based on these new data insights to foster an environment of ongoing advancement in patient care. And by harnessing the power of data, we transform numbers and metrics into actionable insights that drive substantial improvements in patient safety. Effective data analysis allows us to anticipate, respond, and to adapt more swiftly and effectively to safety challenges. And so as leaders, it is our responsibility to champion these data-driven approaches in our organizations. So let's commit to a culture that values and utilizes data to ensure the highest standards of patient safety and not only meet but continuously exceed. So armed with effective data analysis strategies, next we're going to discuss how to manage compliance within ever evolving healthcare regulations to further enhance our patient safety efforts. And so, as we talk about regulatory changes and patient safety, as healthcare leaders, staying ahead of regulatory changes is important to ensure compliance and enhance patient safety. And so, regulations evolve to address emerging health concerns, technological advances, and changes in the healthcare landscape. Today, we'll discuss how to effectively navigate and adapt to these changes to maintain the highest standards of patient safety. So, let's go ahead and explore key strategies for um, adapting to regulatory changes and integrating them into our patient safety practices. So, proactive monitoring, establishing systems for monitoring regulatory changes proactively, and using reliable sources and legal expertise to stay informed about upcoming regulations that could impact your operations. Talking about impact analysis, we conduct a thorough impact analysis for each significant regulatory change. And so assess how these changes affect your current procedures and what adjustments are needed to ensure compliance. As we look at cross-functional regulatory teams, create cross-functional teams that are really dedicated to regulatory compliance. These teams should include legal experts, healthcare providers, and quality assurance professionals who work together to update protocols and training programs. As we look at training and communication, implement comprehensive training programs to educate staff about new regulations. Ensure that all team members understand that the changes and understand the changes and how they affect their specific roles. Talking about technology integration, we want to leverage to simplify compliance, and automated systems can help track regulatory requirements, manage documentation, and ensure that compliance tasks are completed on time. Also, feedback mechanisms. Set up feedback mechanisms to capture insights from staff about challenges and successions and implementing new regulations. And so use this feedback to improve your adaptation strategies continuously. Policy revision sessions. Regularly schedule policy revision sessions to align internal policies with new regulations. This ensures that practices are compliant and up to date. And talking about risk assessment updates, update your risk assessments to consider the implications of regulatory changes. This helps to identify any new areas of vulnerabilities that need to be addressed. And so, as we look at engagement with regulatory bodies, we want to be able to maintain open lines of communication with regulatory bodies. This can provide insight into the intent and details of new regulations and offer a platform for advocacy on behalf of your organization. And continuous improvement culture. Cultivate a culture of continuous improvement that embraces regulatory changes and opportunities to enhance patient safety and care quality. So, by adopting these strategies, we can not only stay compliant with evolving regulations, but also use these opportunities to strengthen our commitment to patient safety. Adapting efficiently ensures that our practices remain at the forefront of healthcare excellence. And so, as leaders, your proactive engagement and regulatory adaptation is critical. It's more than compliance, it's about leadership and patient safety and healthcare quality. So, let's lead by example and ensure that our organizations not only adapt to, but thrive in the ever changing regulatory landscape. With a robust strategy for managing regulatory changes, let's now turn our attention to more specialized risk management techniques in various clinical settings, ensuring that our safety protocols are as comprehensive and effective as possible. So, as we talk about risk identification and assessment, effective patient safety management begins with the ability to identify and assess risk accurately And this proactive approach not only prevents harm, but also ensures that our healthcare practices continuously evolve um, to address potential safety issues before they manifest. And so today we're going to explore strategic methods to enhance our identification and assessment processes. And so as we dive into the essential strategies for strengthening our capabilities in this crucial area, looking at comprehensive risk audits. Um, Regularly, we conduct comprehensive risk audits across all areas of operation. And so these audits should look for vulnerabilities in patient care processes, facility safety, and technology use. So, looking at utilization risk assessment tools, employ standard risk assessment tools that are validated and tailored to specific needs of healthcare environments. And these tools can help systematically evaluate potential risks and their severities. And looking at cross functional risk teams, we want to form cross functional teams that involve clinicians, nurses, pharmacists, and supportive staff that to ensure that a broader perspective is considered during risk assessment. These teams can provide insights from various points of care, enhancing the thoroughness of the assessment. And so, training programs on risk management develop and deliver targeted training programs that equip staff with necessary skills to um, identify and report risks. And so, empowering staff through education and fosters really a proactive and safety culture. As we talk about integration with incident reporting systems, integrating risk assessment with incident reporting systems to capture data on near misses and actual adverse events. So we need to analyze this data, and this data can reveal risk patterns and areas needing immediate attention. Patient and family feedback. Incorporate feedback from patients and their families and as part of the risk assessment process. Their first-hand experiences can provide unique insights into potential safety issues. Talking about technology and data analytics, leveraging technology and data analytics to enhance risk detection and monitoring. Uh, Advanced analytics can predict potential risk hotspots by analyzing historical data and current trends. Environmental safety checks. Regular, regularly perform environmental safety checks to ensure that the physical environment of care does not pose any risk to patient, staff, or visitors. Talking about legal and regulatory compliance reviews, we need to conduct reviews to ensure compliance with all relevant and regulatory requirements, as non-compliance can pose significant risk to patient safety. Continuous feedback and improvement loop. Establish a feedback loop where risk assessment outcomes leads to immediate corrective actions and continuous improvements in protocols. So by enhancing our risk identification and assessment practices, we can create a safer healthcare environment that is responsive and resilient. And so these strategic measures not only mitigate risk, but also build a foundation of trust with our patients and their families. As leaders in healthcare, it is our responsibility to champion these risk management strategies. So let's ensure that risk identification and assessment are embedded into our organizational culture, driving our commitment to uphold the highest standards of patient safety. And so, with a framework for identifying and assessing risks in place, we can now turn our focus to specific training and development initiatives that can support our staff in maintaining and enhancing patient safety. Designing safety protocols. Effective safety protocols are the backbone of patient safety and serving as the foundation for which all our preventative measures rest. And so today we're going to discuss how to design these protocols not only to meet regulatory requirements, but also to exceed them and ensuring optimal safety for our patients and staff. So let's explore the key elements involved in designing and implementing robust safety protocols across our healthcare facilities. Evidence-based design, ensure that all safety protocols are based on the latest clinical evidence and best practices, and this involves regular review of current research and guidelines from trusted organizations. And as we talk about stakeholder input, engage a wide range of stakeholders in the protocol design process. Include frontline staff, patients, and family members. Their insights and experiences can provide valuable perspectives that enhance protocol effectiveness. And so, as we look at simplicity and clarity, design protocols to be simple and clear with straightforward steps that are easy to follow. Complex protocols are more prone to errors, and so clarity is essential. Looking at customization to local needs, tailor protocols to specific needs and context of each department or unit within the healthcare facility. Consider factors like patient demographics, staff expertise, and valuable resources. Gearing towards interdisciplinary collaboration, facilitate collaboration among different healthcare professionals during the protocol design process. This interdisciplinary approach ensures that all aspects of patient care are considered, and technology integration incorporates appropriate technologies into safety protocols to enhance accuracy and efficiency. So, for example, use electronic checklists or automated alerts to support adherence to protocols. Pilot testing. Before full implementation, conduct pilot tests of new protocols in selected areas to evaluate their practicality and effectiveness. And so, use feedback from these tests to make necessary adjustments. Training and education. Provide comprehensive training on new protocols for all relevant staff members. Ensure that training includes why the protocols are important, in addition to how they should be implemented. Continuous monitoring and revision. Regularly monitor the implementation of safety protocols to assess their effectiveness and compliance. Using data from these assessments to revise and improve protocols continuously. Feedback mechanisms. Establish mechanisms for staff providing ongoing feedback on the usability and the effectiveness of safety protocols. This feedback is essential for making this feedback is essential for making improvements. And by meticulously designing and implementing these strategy protocols, we ensure that every action we take in patient care is guided by a framework of safety and excellence. And so this not only reduces the likelihood of adverse events, but also builds a culture of continuous safety and awareness. So, as leaders, your role is crucial in fostering a culture that values and adheres to these well designed safety protocols. So, let's commit to an ongoing improvement that drives superior patient care and outcomes. With our safety protocols firmly in place, let's next explore the legal and ethical considerations that must guide our everyday practice decisions in healthcare. So, talking about crisis management and patient safety. In healthcare, crisis management is not just about responding to emergencies, but also about being prepared as they happen. And so, effective crisis management can significantly mitigate risks and safeguards for both the patient's safety and staff well being during unexpected situations. And so today we're going to explore how to develop and implement effective crisis management strategies that are crucial for maintaining patient safety. So let's discuss some of the key components of a robust crisis management plan. And that every healthcare facility should have in place. And so, as we talk about comprehensive preparedness plans, developing comprehensive crisis management plans that include specific protocols for a wide range of potential scenarios, from natural disasters to pandemics or technological failures. Regular training and drills. Conduct regular training sessions and simulation drills for healthcare staff. These should focus on specific roles and responsibilities during a crisis to ensure that everyone knows what to do and when. So, as we look at communication systems, establish reliable communication systems that remain operational during a crisis. This involves internal communication among staff and external communication with patients and families and the public. Resource management. Ensure that there are protocols for quick mobilization and efficient use of resources during a crisis. So, including medical supplies, personnel, or information technology. And as we look at patient safety prioritization, designate specific protocols that prioritize patient safety during a crisis. Include the secure and rapid relocation of patients if necessary, and the continuation of critical care. As we look at partnerships and collaboration, form partnerships with other healthcare organizations, government agencies, and the community groups. These relationships can provide additional support and resources during a crisis. So, as we look at psychological support services, provide accessible psychological support for both patients and healthcare staff during a crisis to address mental health impacts, which are often significant. Continuous monitoring and adjustment. Monitor the ongoing situation and responses as needed. This dynamic approach allows the flexibility needed for crisis situations. Talking about post-crisis and review and learning, after a crisis, conduct a thorough review of the response and identify what worked well and what did not. Use these insights to strengthen further crisis responses. Also, leadership and decision making. Ensure clear leadership and decision making structures. Make sure that they're in place for crisis situations. Having strong leaders who can make quick, informed decisions is critical during an emergencies. And so, effective crisis management is all about preparation and the ability to respond swiftly and efficiently. And so, by having these systems in place, we can ensure that healthcare facilities are ready to handle emergencies while maintaining the highest level of patient safety. As healthcare leaders, it's our responsibility to ensure that our organizations are not only equipped to handle crises, but also excel in these challenging situations. And so let's take the opportunity to take action today to strengthen our crisis management plans and safeguard the lives of those that we serve. And so, with a solid framework for crisis management in place, we now can turn our attention to how we communicate tools that can further enhance our patient safety efforts, ensuring clarity and efficiency in all of our interactions. And so, talking about communication tools for safety, clear and effective communication is vital in maintaining patient safety, especially during critical situations or routine care. And so, advanced communication tools can significantly enhance our ability to transmit information quickly and accurately. And so, today we're going to explore key communication tools that can help us improve safety outcomes across our healthcare facilities and organizations. So, let's explore some of the several of the innovative tools and strategies that facilitate better communication within our healthcare teams and also with our patients. Electronic health records, EHRs. Leverage EHRs to ensure that all patients' information is updated in a real time and accessible to every member of the care team, regardless of their location. This reduces the risk of errors due to outdated or missing information. And secure messaging platforms. Implement secure messaging platforms that allow for quick and confidential communication among healthcare staff. These platforms should comply with privacy regulations and also provide a reliable way to discuss patient care issues. Discuss digital whiteboards. Use digital whiteboards in patient care areas to display critical information about patient status, care plans, and staff assignments. This visibility helps teams stay informed and coordinated. Patient portals. Encourage the use of patient portals that enable patients to access their health information, communicate with their providers, and manage appointments. Portals empower patients to participate actively in their own care. And as we talk about automated alert systems, use automated alert systems to notify care teams of important changes or changes in patients' conditions. These alerts can be critical in preventing adverse events by ensuring timely interventions. Telemedicine tools. Expand the use of telemedicine tools, especially in remote areas or situations where in-person visits are not feasible. These tools can improve access to care and also ensure ongoing communication between patients and healthcare providers. Talking about language translation services, provide language translation services either through live interpreters or digital tools to ensure that all patients receive information in their preferred language and reducing the risk of misunderstanding. Communication training programs. Regularly train staff in effective communication techniques, including how to use communication tools properly and how to ensure a clear and compassionate interaction with patients. Feedback and reporting systems. We want to incorporate systems for staff and patients to provide feedback on ongoing effectiveness and reporting communication failures. And this feedback really is crucial for continuous improvement. Crisis communication plans. Develop and regularly update plans for crisis communication to ensure that accurate information is disseminated quickly and efficiently to all stakeholders during emergencies. So by integrating these advanced communication tools in our daily operations, we can enhance not only the efficiency but also the safety of our healthcare services. Effective communication is a critical safety net that helps prevent errors and improves patient outcomes. So as leaders, it's imperative that we champion the adoption and effective use of these communication tools. So let's commit to fostering an environment where every voice is heard and every message is clear for the safety and well-being of our patients. With robust communication tools in place, we are better equipped to train our teams effectively. So let's move forward to discuss training techniques that can further enhance our patient safety initiatives. So as we talk about safety training techniques, training is a critical component of our patient safety strategy, and ensuring that every member of our healthcare team is equipped to deliver the highest standards of care. And so innovative training techniques can make these programs more effective and engaging. So today we're going to explore cutting edge training methods that can enhance our safety practices and foster a culture of continuous learning. So let's look at some of the most effective training techniques currently transforming patient safety training and healthcare settings. Simulation-based training. Utilize high-fidelity simulations that replicate real-life scenarios to allow staff to practice responses to various medical situations in a risk-free environment. This hands-on approach helps improve decision-making skills under pressure. Talking about interactive e-learning modules. Develop interactive e-learning modules that include videos, quizzes, and gamification elements. These models can be assessed on demand, allowing staff to learn at their own pace and revisit the material as needed. Also, virtual reality VR training. Incorporate VR technology to immerse staff in realistic patient care scenarios. VR training can be particularly effective in teaching complex procedures and emergency response techniques. Augmented reality applications and employing AR to overlay digital information onto the real world during training sessions. AR can guide procedures step by step, providing intermediate feedback and enhancing leader learning retention. As we talk about peer learning workshops, uh, organization organizations organize peer learning workshops where staff can share experiences and best practices. These workshops promote collaborative learning and can spark innovative ideas for improving patient safety. Micro learning sessions. Implementing micro learning sessions, which are short, focused segments designed to teach or reinforce lessons in about 5 to 10 minutes. These sessions are perfect for busy healthcare environments as they fit easily into the daily workflow. Competency based training. So, adopt a competency based training approach that focuses on specific skills needed by staff to master. And so, methods ensure that these trainings are tailored to the individual's role and responsibilities and enhancing relevance and effectiveness. Feedback driven development. Use feedback for training sessions to continuously improve training and content and methods. And so this process ensures that training remains relevant and effective in addressing the current challenges of patient safety. And leadership development programs, they really offer specialized training programs for healthcare leaders that focus on managing and promoting patient safety. And so these programs help leaders understand how to foster a safety culture and also lead by example. Cross disciplinary training initiatives. Encouraging cross disciplinary training initiatives that bring together different specialists, such as nurses, doctors, and pharmacists, to learn from each other's perspectives. This holistic approach enhances teamwork and understanding across departments. And so, by deploying these innovative training techniques, we can ensure that our staff are not only well prepared to handle safety challenges, but are also motivated and encouraged in their roles. So, effective training is a key to empowering our teams to deliver safe, high quality care consistently. As leaders, it is our responsibility to champion these advanced training initiatives. And so let's commit to investing in our valuable assets, our people, by providing them with the best tools and training to succeed. Together, we can achieve a safer healthcare environment for everyone. Equipped with these advanced training techniques, our next step is to ensure that all of our safety protocols are up to date and effectively implemented across our operations. So, as we talk about reporting systems for safety incidents, an effective safety culture is built on transparency and learning from its incidents. And so, robust reporting systems is crucial not only for tracking safety incidents, but also for learning from them and preventing future occurrences. And so, today, I hope that we'll discuss how to establish and maintain effective reporting systems that enhance our ability to manage patient safety proactively. So let's examine some of the key components of an effective incident reporting system and how it can drive continuous improvement in patient safety. So, accessibility and simplicity. We want to ensure that reporting systems are easily accessible to all staff members and simple to use. And complexity should not be a barrier to reporting. The easier it is to report, the more likely staff will use it. So, non-punitive environment. Creating a non-punitive reporting environment where staff feel safe to report mistakes and near misses. And so emphasizing that the purpose of reporting is not to assign blame, but to learn and improve. And so as we look at immediate feedback, providing immediate feedback to those who report incidents. This feedback should acknowledge the report, provide initial findings, and detail any immediate actions taken. But this also encourages continued participation and trust in the system. And as we look at comprehensive data analysis, using data collected from the reporting system for comprehensive analysis helps to identify patterns and trends. And so this analysis should inform strategic decisions about where to focus patient safety efforts. Integration with quality improvements. We really want to integrate incident reporting with overall quality initiatives. Incidents reports should be a key for input for quality improvement teams seeking to enhance patient care processes. And so training and awareness, we want to regularly train staff on the importance of incident reporting and how to effectively use reporting systems, including scenario-based training to help staff understand what types of incidents should be reported. Confidentiality and security. Maintaining confidentiality and security incident reports to protect staff and patient privacy. This also helps in maintaining trust in the reporting system. Regular reviews and updates. Regularly reviewing and updating the reporting system to ensure that it remains relevant, effective, and aligned with the latest strategies help to improve safety standards and also technology advancements. So leadership involvement really ensures active involvement of leadership in the incident reporting process. And so leaders should regularly review report outcomes and lead by example in encouraging a transparent safety culture. Cross-organizational learning. Facilitate learning across the organization by sharing lessons learned from safety incidents widely. This can include safety newsletters, regular safety meetings, and updates during staff briefings. So by fostering a culture that actively uses and learns from an incident reporting system, we enhance our ability to respond and prevent safety issues, ultimately leading to higher standards of patient care. And so as leaders, it is our duty to champion these reporting systems, and it lets us commit to ensuring that every voice is heard and every lesson is learned, and building a safer healthcare environment for everyone. Armed with a robust incident reporting system, let's now focus on how we can engage patients and their families more deeply to enrich our safety culture and enhance our care outcomes. So, as we talk about reporting systems for safety incidents, an effective safety culture is built on transparency and learning from those incidents. And so, patient and family advisory councils. Engaging patients and their families in our safety initiatives is not just beneficial, but it's also essential. So, patient and family advisory councils, or PFACs, provide a structured way to draw the experiences and insights of those who we serve. And so today we'll explore how PFACs can significantly enhance our patient safety and care quality by fostering a collaborative environment. So let's discuss the key benefits of establishing PFACs and how they can effectively integrate those into patient safety efforts. Diverse perspectives. PFACs bring diverse perspectives into safety and quality discussions, offering insights that might not be apparent to medical staff but are crucial to patient-centered care. And so as we talk about improved care processes, we want to look at that as by involving patients and families, we can identify gaps in care processes and develop solutions that directly address patient needs and concerns, leading to improvement in care delivery. And so, talking about enhanced communication strategies, PFACs can help refine the way in which informed information is communicated to patients and families, ensuring clarity and understanding, which are essential for effective care. Building trust, active collaboration with patients and families builds trust and reinforcements the commitment to the healthcare facility to be more transparent and patient centered. Designing educational materials, work with PFACs to design patient educational materials that are understandable, accessible, and culturally sensitive, enhancing patient engagement and compliance. Talking about policy development input, include PFACs members in policy development discussions to ensure that patient safety policies reflect the needs and realities of patients and their families. Feedback on safety initiatives, use PFACs and soundboard as sounding boards for new safety initiatives to gauge potential reception and effectiveness, allowing for adjustments before wider implementation. So, as we talk about promoting safety cultures, PFACs promote a culture of safety by demonstrating that patient and family voices are valued and essential in continuous improvement efforts. And so, as we talk about long term relationships, develop these long term relationships with PFAC members to ensure ongoing engagement and continuity and safety improvement efforts. So, recognition and validation. Recognize and validate the contributions of your PFAC members, and this recognition encourages continued involvement and affirmations of the value of their input. And so implementing practices and family advisory councils is a powerful strategy to enhance patient safety, care quality by valuing the voices of patients and their families. We can create a more responsive, effective, and compassionate healthcare environment. As healthcare leaders, let's commit to fostering these partnerships. Engaging with and listening to our PFACs can transform the way we approach patient safety by making our facilities safer and more attuned to the needs of those we serve. And so, with a strong foundation in patient and family engagement through PFACs, let's now turn our attention over to how we can utilize quality improvement teams to further enhance our safety protocols and care standards. So, quality improvement teams and are pivotal in our continuous efforts to enhance patient safety. These teams play an important role in identifying and implementing and evaluating practices that can lead to significant improvement in the care that we provide. And so today, I hope that we will discuss and explore how to effectively organize and utilize these teams to foster an environment of continuous safety and quality enhancement. So let's explore the key functions of quality improvement teams and how they can drive patient safety initiatives within our organization. So as we look at interdisciplinary membership, form teams comprising diverse healthcare professionals from various disciplines. This diversity brings multiple perspectives and expertise to the table, enriching the problem-solving process. And so, as we gauge ourselves into clear objectives and goals, establish clear and measurable objectives for each quality improvement initiative. Goals should be specific, achievable, and directly tied to enhancing patient safety and outcomes. So, regular data review, equip teams with regular access to clinical data and patient feedback. Analyzing this data allows teams to identify trends and areas needing improvement and guiding their focus and actions. And so, as we talk about implementation of best practices, we want to charge these with teams with researching and implementing evidence based best practices. So, encouraging innovation and adaptation of practices to fit the specific context of healthcare facility. Um, Continuous improvement and training provide ongoing training and resources to help members to keep up to date on the latest quality improvement methodologies and technologies. And as we talk about pilot testing of changes, before broader implementation, have teams pilot changes in controlled environments to assess their effectiveness and feasibility. This step helps to minimize disruption to the overall operations while testing new ideas. And so, feedback loops as well. Creating feedback loops allows for adjustment of practices based on outcomes. And so, this process is essential for fine tuning interventions until desired outcomes are achieved. And developing strategies for effective communication, not only within the team, but also across the organization. And sharing progress and successes helps build support for quality initiatives and fosters a culture of transparency. And recognition and incentivization. Uh, Recognize and reward teams and individuals for their contribution to quality improvement. Incentives can motivate ongoing commitment and enthusiasm for patient safety efforts. And as we talk about sustainability plans, ensure that quality improvement initiatives include a plan for sustainability. And this means embedding successful changes in everyday practices and monitoring long term outcomes. Quality improvement teams are essential engines of change. And so, driving our efforts to ensure that patient care is continuously evolving towards greater safety and effectiveness. And so, by leveraging these teams effectively, we can ensure that improvements are not only implemented but also durable and lead to long-lasting benefits. And as leaders, it is our responsibility to support and empower these teams and provide them with the tools and the authority needed to make meaningful improvements. So let's commit to these principles of continuous quality improvement to enhance safety and quality of care as we provide. And so, with our quality improvement teams actively enhancing procedures and protocols, let's now examine how benchmarking against national and international can further refine our safety initiatives. And so, as we look at benchmarking for patient safety, benchmarking is a powerful tool that allows us to measure our performance against the best in the field and identify areas where we can improve. And so, in this context of patient safety, benchmarking provides critical insight that helps us to evaluate our care standards to ensure that we're providing the safest and most effective service to our patients. So, today we're going to explore how benchmarking can drive improvements in patient safety across our healthcare organization. And also, we're going to look into the key aspects of benchmarking that can help us enhance our patient safety initiatives. So, identifying benchmarking partners. Select benchmarking partners that exemplify excellence in patient safety. These can be other healthcare facilities, national health systems, or international standards that reflect best practices in safety. And so, as we gear ourselves into data collection and analysis, gathering and analyzing data on specific safety metrics such as infection rates or patient falls or medication errors. We want to compare these metrics against those of your benchmarking partners to identify performance gaps. And so, setting realistic targets based on benchmark data, setting realistic improvement strategies for your organization. These challenge your team to elevate their performance while also still being achievable. And so, as we chat about implementing best practices, Adopt best practices for leading organizations that have demonstrated success in areas where you seek improvement, and tailor these practices to fit your specific organizational context and needs. Continuous monitoring and continuously monitoring your performance and against established benchmarks. This ongoing evaluation helps sustain focus on patient safety goals and keeps the organization aligned with industry standards. Engaging staff. Involve staff at all levels in the benchmarking process. Their engagement is important as they can provide insights into practical aspects of implementing change and helping internal acceptance and motivation. So, feedback and adaptation. Use feedback from benchmarking efforts to adapt and refine patient safety strategies. This iterative process really ensures that your practice remains current and effective. And so, as we talk about transparency and reporting, maintaining transparency with internal and external stakeholders about benchmarking outcomes and ongoing efforts to improve patient safety. This transparency will build trust and accountability. And so, as we talk about investing in technology and training, we want to invest in necessary technology and training to meet and exceed benchmark standards. And so, this could include advanced safety monitoring tools or safety training programs. And also, don't forget to celebrate successes. Recognize and celebrate achievements in meetings or exceeding benchmark goals. And so, celebrating these successes can boost morale and reinforce the value of benchmarking processes. Through these effective benchmarking, we are not only keeping pace with leading standards, but also fostering a culture of continuous improvement and excellence in patient safety. And benchmarking pushes us to strive for better and safer care every day. And so, as healthcare leaders, it is our responsibility to champion these benchmarking initiatives. So, let's leverage the tools to inspire and drive teams towards excellence and patient safety, and really ensuring that we deliver the highest quality of care to our patients. Armed with the insights from our benchmarking efforts, lets us now turn our attention to enhancing safety protocols across various clinical areas to ensure comprehensive coverage and adherence to the highest safety standards. So, as we talk about safety audits and feedback loops, safety audits and feedback loops are critical tools in the quest to maintain and enhance patient safety. These processes help us not only to assess the effectiveness of our safety measures, but also to engage in an ongoing dialogue that fosters improvement and innovation. And so today, as we explore how to effectively conduct safety audits and establish feedback loops that drive meaningful change in our healthcare settings, let's explore the essential components and benefits of integrating comprehensive safety audits and robust feedback mechanisms in our safety practices. So, regular safety audits. Regularly conduct systematic safety audits across all departments. These audits should evaluate adherence to established safety protocols and also to identify potential risk for non-compliance areas. And so, as we look at cross-functional audit teams, use cross-functional audit teams for audits to ensure diverse perspectives that are considered. Uh, this approach can help uncover issues that might not be evident to a single department or team. And so, as we look at real time reporting systems, implement real time reporting systems that allow staff to report safety concerns as they occur. And so, quick access to reporting encourages immediate attention and action. So, as we look at transparent feedback loops, develop transparent feedback loops that communicate the findings from audits and report them back to all relevant staff. And this transparency helps to build trust and encourage activity and participation in safety initiatives. Actionable insights. Ensure that findings from safety audits are translated into actionable insights. And so develop clear plans for addressing identifiable issues and assign responsibility for implementing these plans. As we talk about continuous training based on audit results, use the results of safety audits to inform ongoing training programs and tailoring training to address specific weaknesses or recurring issues can significantly enhance overall safety. Patient and family involvement. Involve patients and their families in safety audits by seeking their feedback on their experiences and perceptions of safety. And this input can provide value insights into areas needing improvement. And looking at benchmarking performance, benchmark audits results against internal goals and external standards. And so this benchmark helps to motivate improvements and track progress over time. Celebrating improvements, recognizing and celebrating improvements and successes identified through audits and feedback. Celebrating these achievements can boost morale and reinforce the importance of everyone's role in patient safety. An iterative review and adaptation. Regularly review and adapt safety protocols based on audit outcomes and feedback to ensure that they remain effective and relevant as conditions and technologies evolve. So, by integrating rigorous safety audits and effective feedback loops into our operations, we not only enhance our capacity to respond to immediate safety concerns, but also foster an environment of continuous improvement and accountability. So, as leaders in healthcare, it is our duty to ensure that these processes are not merely routine checks, but also dynamic tools for improvement. So, let's commit to upholding the highest standards of safety through diligent audits and responsive feedback. Equipped with a robust system for audits and feedback, we can better prepare to tackle complexities of patient safety. Moving forward, let's go ahead and discuss the role of technology updates and future enhancing our safety measures. So, technology updates and safety, and in the rapidly evolving field of healthcare, keeping our technology updated is important for maintaining and enhancing patient safety. So today we're going to explore the significant impact of technology updates on patient safety and how staying current with technological advances can prevent errors and improve care. So let's discuss key strategies for ensuring our technology not only meets current standards, but also leverages current edge innovation to enhance safety. So regular technology assessments. We want to conduct regular assessments of existing technology, determines its efficacy, security, and relevance. This helps identify areas where updates are needed to maintain latest safety standards. And so as we look at strategic upgrade plans, develop strategic plans for technology upgrades that prioritize patient safety. And so these plans should consider the potential impact of new technology on current workflows and include timeline for implementation. Staff training and competency. Ensure that all healthcare staff are thoroughly trained on any new technology before it's implemented. And continuous education on technological advancement should be a priority to maximize their potential for improving patient safety. As we talk about integration with existing systems, we want to focus on integrating new technology with existing systems to ensure seamless operation. Proper integration reduces the risk of errors that can occur when systems do not work well together. And as we look at vendor participation, establishing strong partnerships with technology vendors who are committed to the highest standard of patient safety, these partnerships can provide access to the latest technologies and supportive services. Uh, Looking at cybersecurity measures, updating cybersecurity measures concurrently with new technology implementations, protecting patients' data from breaches is a critical aspect of patient safety. And so, feedback, as we look at feedback mechanisms, we want to also implement feedback mechanisms that monitor the effectiveness of new technologies. And so, feedback from frontline users is invaluable for identifying unforeseen issues and areas needed that are needed for improvement. And so, as we look at pilot testing, utilizing pilot testing for new technology implementations, testing in a controlled environment allows for adjustments to be made before a full scale deployment. Regulatory compliance ensures that all technology updates comply with relevant health regulations and standards. And so staying compliant not only ensures legal safety, but also ensures patient trust and safety. Performance metrics monitor and evaluate the performance of updated technologies using specific metrics related to patient safety. So such as error rates, speed of care quality and delivery, and patient outcomes. So keep our so by keeping our technology up to date, we not only enhance our operational efficiency, but we also significantly improve the safety and quality of care that we provide for our patients. And this proactive approach ensures that we are always at the cutting edge of patient safety. And as leaders in healthcare, let us be champions of technological innovation. Let's commit to ongoing technological updates that prioritize and enhance patient safety so that we can ensure that we continue to deliver the best possible care. And so, with our technology consistently updated, we are now better equipped to implement cross departmental safety initiatives that further our goals from comprehensive patient care. And so, cross departmental safety initiatives, patient safety is a multidisciplinary responsibility that really benefits greatly from cross departmental collaboration. And so, today we're going to discuss how initiating safety projects that involve multiple departments and can enhance overall safety outcomes by promoting a more integrated approach to patient care. So, let's explore effective strategies for launching and managing cross departmental safety initiatives that can lead to significant improvements in patient safety across our entire healthcare system. So, identifying common goals by let's begin by identifying safety goals that impact multiple departments. Common goals ensure that all the teams are aligned and working towards the same outcomes, and which foster a sense of unity and purpose. And so, establishing multidisciplinary teams, forming multidisciplinary teams for each safety initiative, um, really including representatives from nursing, medicine, pharmacy, administration, and other relevant departments. These teams bring diverse perspectives and expertise, and important for comprehensive safety solutions. And looking at shared training sessions, we want to organize shared training sessions that involve participants from different departments. And this not only builds a common understanding of safety protocols, but also enhances team cohesion. Looking at joint safety protocols, develop joint safety protocols that address the specific interaction between departments. Ensures that these protocols are clear, accessible, and regularly reviewed to reflect any changes in practice or policy. And so, as we look at communication platforms, utilize robust communication platforms that allow for easy information sharing and collaboration among departments. Effective communication is the key to success of any cross departmental initiative. And so, as we look at regular coordination meetings, um, holding regular coordination meetings to discuss progress, tackle challenges, and make necessary adjustments to the safety initiatives. These meetings are vital for maintaining momentum and ensuring that continued engagement from all parties is present. And so, looking at performance metrics, we want to define clear performance metrics that measure the effectiveness of the safety initiatives across departments. And these metrics should help track improvements in patient safety and identify areas needing further attention. So, creating effective feedback loops, which allow staff to report on the practical aspects of implementing cross-departmental safety measures. Giving feedback should be actively used to refine and improve protocols. And so, as we celebrate successes, we want to recognize and celebrate the successes of cross-departmental initiatives. And celebration can motivate teams and highlight the value of collaboration in achieving safety goals. And as we look into continuous improvement processes, implementing a continuous improvement process that allows for ongoing optimization of cross-departmental safety initiatives, this process should give regular review and adaptation based on outcomes and new safety research. So by fostering collaboration across departments, we create a safe culture that leverages the collective expertise of our healthcare professionals, leading to more effective and sustainable safety outcomes. So, as leaders, it is essential that we champion and facilitate these cross-departmental collaborations, and let's work together to break down these silos and build a unified front in our pursuit of the highest standards of patient safety. Equipped with a robust framework from cross-departmental collaboration, we are now better prepared to tackle the challenges of medication management safely and effectively. So, as we look at safety and medication management is really a critical area and patient safety due to its potential for harm and if it's not handled properly. So ensuring that safe administration of medication really requires meticulous systems and processes. And so today we're going to explore strategies to enhance the safety and effectiveness of medication management across our healthcare settings. So let's dig into the key approaches and practices that can help us improve safety and medication management. Standardized protocols. As we implement standardized protocols for prescribing and dispensing and administering medications, these should include checks at each stage to prevent error and to ensure that patients receive the correct medication at the correct dosages. And so, as we look at electronic prescribing systems, utilizing electronic prescribing systems to reduce errors related to handwriting and manual entries. These systems can also improve automatic drug interaction checks and dosage recommendations. Medication reconciliation. Conducting thorough medication reconciliations at each transition of care. This process ensures that medication orders are correct and are all accounted for, reducing the risk of omissions or duplications. And so, looking at patient education, engaging in the comprehensive patient education regarding the use and the side effects and interactions and storage of medication help to educate patients and are more likely to use medication safely and report any adverse effects promptly. Exploring regular staff training, providing ongoing training for all healthcare staff involved in medication management. This training should cover new protocols, technologies, and any changes in medication-related regulations. Also, automated dispensing cabinets Installing automated dispensing cabinets in patient care areas to improve medication safety and inventory management. These systems can help to ensure that medications are securely stored and dispensed correctly. As we look at medication safety officers, appoint a medication safety officer to oversee all aspects of medication management. This role involves analyzing medication use practices, conducting safety audits, and leading improvement initiatives. Monitoring and reporting of adverse drug events. Establish systems for monitoring and reporting adverse drug events. Analyzing these events can provide critical insights into potential system failures and also areas for improvement. Quality checks. Performing regular quality checks on medication management processes. These checks help to ensure compliance with the safety protocols and identify opportunities for process enhancements. Looking at collaboration across departments, foster collaboration between pharmacists, nurses, and physicians to ensure a multidisciplinary approach to medication safety. Each profession brings unique insights that can contribute to safer medication practices. By implementing these strategies, we are not only reducing the risk of medication errors, but also enhancing the overall safety and quality of care provided to our patients. And so, effective medication management is a cornerstone of patient safety. And as leaders in healthcare, it is our duty to prioritize medication safety and to continuously seek improvements in our systems and processes. And so let's ensure that our commitment to medication safety is reflected in every day and every action that we take every day. And so with a robust approach to medication management in place, we are better now equipped to handle the complexities of surgical procedures safely and effectively. So now let's talk about safety and surgical procedures. Surgical settings are complex environments where patients' safety must be managed with the utmost care and precision. And so today we're going to discuss the critical strategies that enhance safety and surgical procedures, ensuring that every operation is conducted under the safest possible conditions. So let's explore effective measures to minimize risk and improve in surgical settings. As we look at preoperative planning, implementing through preoperative planning processes include detailed medical histories, pre-surgical screenings, and patient consultations. This helps identify potential risks and prepare appropriate interventions in advance. So as we look at standardized checklists, using standardized surgical staff safety checklists for every procedure, these checklists are important for ensuring that all necessary steps are completed before, during, and after surgery, reducing the likelihood of errors. And so as we look at team briefings and debriefings, conduct preoperative briefings and post-operative debriefings for all surgical teams. These meetings ensure that everyone is informed about the specific details on the case and then can discuss any concerns or unusual aspects encountered during the procedure. So looking at training and team communication, providing ongoing training and effective communication for all surgical staff. Good communication during surgery can prevent many errors and improve team coordination in response to emergencies. And so monitoring anesthesia safety, we want to enhance monitoring techniques and anesthesia safety practices. And so using advanced monitoring equipment to continuously assess patient vital signs and anesthesia depth during surgery. So also, as we talk about infection control protocols, we want to adhere strictly to infection control protocols to include proper sterilization of instruments, use of barriers, and antibiotic prophylaxis when necessary to prevent post-operative infections. As we talk about simulation based training, utilize simulation based training for surgical staff to practice handling surgical complications and emergencies in a controlled, risk free environment. Um, Surgeon competency and credentialing. Ensure that all surgeons are properly credentialed and maintain their competency through regular continuing medical education, peer reviews, and performance evaluations. So, patient education and consent. We also want to provide comprehensive education to patients regarding their surgical procedures, potential risks, recovery expectations, and postoperative care. So, ensure informed consent is obtained and documented. Looking at technology and surgical innovations, uh, incorporating the latest technological advances and surgical innovations into practices as appropriate. And these can include minimally invasive techniques, robotic surgery, and real time imaging guidance to enhance precisions and outcomes. And so, by rigorously applying these safety measures, we can significantly reduce risk and enhance patient outcomes. Safety in surgery is not just about avoiding complications, but it's also about systematic preparation, execution, and follow up. So, as leaders in healthcare, it is our responsibility to champion these surgical safety protocols. And so, let's examine a culture of safety that permeates every aspect of surgical departments, ensuring that every patient receives the safest care possible. And so, with a strong foundation in surgical safety, we will now turn our focus to handling safety complaints effectively, ensuring that we listen and learn from every patient interaction to continuously improving our practices. So, as we talk about handling complaints, handling safety complaints effectively is crucial for maintaining trust and improving patient care in our healthcare facilities. And it's essential that we address these complaints properly and promptly and thoroughly to learn from them and to prevent future occurrences. So, today we're going to discuss strategies for managing safety complaints effectively and ensuring that every concern is raised by patients or staff and is treated as an opportunity to improve. So, let's explore the best practices for managing safety complaints within our healthcare organizations. Let's explore clear reporting channels. Establishing clear and accessible channels for patients and staff to report safety concerns. These should be well publicized and easy to use, ensuring that everyone feels comfortable and empowered to speak up. So, non retaliation policies. Enforcing a strict non retaliation policy to protect those who report safety issues. This policy should be clearly communicated to all employees and reinforcing our commitment to safety and transparency. Timely response, ensuring that all complaints are acknowledged and addressed in a timely manner. Quick responses are crucial for preventing escalation of issues and for maintaining trust in our safety processes. And so, as we talk about thorough investigation, conduct thorough investigations into each complaint to determine underlying causes. This should involve a multidisciplinary team and may include interview observations and data reviews. As we look at feedback to complaints, keeping complaints informed and keeping complainants informed throughout the investigation process and share the outcomes and actions taken. And this openness not only builds trust, but also demonstrates our commitment to resolving issues. Looking at a root cause analysis, utilizing root cause analysis tools to dig deeper into complaints and understanding why incidents occurred. This helps to develop more effective strategies to prevent future issues. Learning and improvement, using insights gained from complaints to driving systematic changes in our healthcare practices. This could involve updating protocols, enhancing training, or modifying workflows. Documentation and tracking, maintaining detailed records of all complaints, investigations, and outcomes. This documentation helps in tracking trends over time and evaluating the effectiveness of our overall corrective actions. As we look at regular training, providing regular training for staff on how to handle and respond to safety complaints effectively, this includes aspects of communication, empathy, and legal considerations. Reviewing and auditing. Regularly review and audit the complaint handling process to assess its effectiveness and make necessary improvements. This should be part of a continuous quality improvement strategy within the organization. And by handling safety complaints effectively, we not only address specific issues, but also strengthen our overall safety culture. So each complaint handled well reinforces our dedication to patient safety and continuous improvement. And as leaders, it is our duty to ensure that these complaint handling processes are robust and reflective of our unwavering commitment to patient safety. So let's ensure that every complaint is seen as a chance to learn and improve and demonstrate our dedication to and dedication to the well-being of our patients and staff. And with effective complaint handling protocols in place, we can move forward confidently and knowing that we are prepared to handle any issues and turn them into opportunities for improvement. Next, let's discuss the integration of safety practices across all levels of our organization to enhance our holistic approach to patient care. So as we talk about integrating practices across all levels of safety, it is a shared responsibility that requires commitment from every level within our organization. And so as we talk about integrating safety practices throughout our healthcare system, it really ensures that every member of our staff, from administration to clinical support staff, is really aligned and engaged with our safety goals. So today we're going to explore strategies to embed safety practices across all levels and creating a cohesive and proactive safety culture. So let's discuss how we can ensure that safety practices are not only adopted, but also ingrained in every aspect of our operations. Leadership commitment. Safety starts at the top, and our leadership must not only endorse safety initiatives, but also actively participate in them. And so this includes regular safety training, visibility and safety programs, and clear communication about the importance of safety and organizational priorities. Safety training for all staff. Implement comprehensive safety training is mandatory for all staff, regardless of their role. This training should be regular, updated, and tailored to meet the specific safety needs of different departments. Safety champions identify and empower safety champions in every department. And these individuals can help drive safety initiatives, act as a point person for safety concerns, and motivate their peers to uphold safety standards. As we look at cross-departmental safety committees, establish cross-departmental safety committees that meet regularly to discuss safety issues and share best practices and coordinate safety efforts across the organization. As we look at incorporation of safety and job descriptions, ensure that safety responsibilities are included in job descriptions and performance evaluations. This integration highlights the importance of safety in professional roles and accountability. And so patients and family involvement, we want to engage patients and their families in safety initiatives by providing them with education on staff practices and involving them in safety planning meetings. And so their perspective can offer valuable, excuse me, their perspective can offer valuable insights into improving patient care and safety. And so regular safety audits and feedbacks. Conduct regular safety audits and establish feedback mechanisms that allow staff to contribute to staff discussions anonymously. This can help in identifying unseen issues and promoting a culture of open communication. Reward and recognition programs also help to develop and reward reward and recognition programs that really acknowledge individuals and teams for understanding safety practices, and recognizing efforts can reinforce the value placed on safety and encouraging continuous participation. Integration of safety into our daily operations. As we embed safety checks and briefings into the daily routines of all departments, this constant reinforcement helps keep safety at the forefront, but also on everyone's mind during their daily activities. And so, as we look at continuous improvement processes, adopt a continuous improvement approach to safety. Regularly review safety procedures, outcomes, and staff feedback to identify areas for improvement and implement the necessary changes. Also, by integrating safety practices across all levels of the organization, we can ensure that safety is not just a policy, but also a fundamental part of our culture. And this comprehensive approach guarantees that safety considerations are woven into every decision and action. And as leaders, it is our responsibility to drive this interaction. And let's commit to a unified and consistent approach to safely empower and every individual in our organization to contribute to a safer healthcare environment. And so, with a solid strategy of safety integration in place, let's move forward and explore advanced risk prediction techniques that can further enhance our proactive safety measures. And so, as we look at advanced risk prediction techniques and the ever-evolving landscape of healthcare, the ability to predict and preemptively address potential risk is a significant advantage. And so, as we look at advanced risk prediction techniques, leveraging data analytics and artificial intelligence can help us to identify potential safety issues before they manifest. So today we're going to explore how these technologies can be implemented to enhance our proactive patient safety strategies. So let's dive into several advanced techniques that can transform our approach to patient safety by enabling us to anticipate and mitigate those risks. So as we look at predictive analytics, we want to use predictive analytics to analyze historical and real-time data to foster potential safety issues. And these tools can help to predict everything from patient falls to potential medication errors, allowing us to intervene before incidents occur. And machine learning models. Implement machine learning models that continuously learn from healthcare data. So these models improve over time, but becoming increasingly accurate in identifying patterns that precede adverse events. And as we look at risk scoring systems, we want to develop risk scoring systems based on algorithms that assess patient data to identify those at high risk for complications. And so these systems can be used to allocate resources for more effectively and tailored patient care plans. Natural language processing, so NLP. Using NLP to extract meaningful information from unstructured data sources such as clinical notes, the NLP can reveal hidden risks that are not captured in structured data, so enhancing our understanding of patient needs. And looking at real-time health data monitoring, employing real-time health monitoring technologies that track vital signs, and other health indicators. Alerts can be set up by notifying staff when parameters deviate from normal ranges and prompting an immediate action. Exploring simulation modeling, using simulation models to predict the outcomes of various safety interventions before implementing them in a real world setting. This can help to optimize our strategies based on predictive effectiveness. And as we look at geospatial analytics, applying geospatial analytics to analyze the physical layout of healthcare facilities and patient movement patterns, this can help to identify high risk areas where additional safety measures may be necessary. And then as we talk about Internet of Medical Things, the IOMT, integrating IOMT devices that collect and transmit data from a wide range of sensors and devices. This interconnected data stream can be analyzed to predict and prevent potential safety issues across the healthcare ecosystem. Feedback loops, establish automated feedback loops that will use the data from predictive tools to continually redefine models and interventions. This ensures that our strategies are adaptive and responsive to the latest data insights. And so, as we look at staff training and data literacy, investing in training for healthcare staff to understand and utilize data from predictive models and tools, empowering staff with data literacy skills is important for the effective adoption and utilization of these new technologies. And so by leveraging these advanced risk prediction techniques, we are not just reacting to patient safety incidents, but we're also preventing them. And so these tools enable us to be safer, more efficient, and more personalized care to our patients. So as leaders in healthcare, let's champion the adoption of these predictive technologies. It's our responsibility to ensure that our facilities are not only equipped with the latest tools, but also that our teams are proficient in using them to enhance patient safety. Equipped with powerful predictive tools, we now turn our next focus, developing and maintaining effective disaster recovery plans to safeguard our operations and our patients in any eventuality. So, disaster recovery plans in healthcare. Disaster recovery is an essential component of healthcare management and ensuring that our facilities are prepared to respond quickly and effectively in the face of emergencies. Whether these are due to natural disasters, technological failures, or pandemic outbreaks, having a robust disaster recovery plan is critical for maintaining continuous patient care and safeguarding data. So, today we're going to discuss how to develop and maintain effective disaster recovery plans that are important for and critical for our patient safety and operational stability. So let's explore the key elements of a comprehensive disaster recovery plan and the strategies to implement it successfully. So as we look at risk assessment, we're going to begin with a thorough risk assessment to identify potential threats specific to our location, technology, and operations. Understanding these risks will guide the development of targeted strategies in our disaster recovery plan. So, essential function identification. Identify and prioritize essential functions and services that must be maintained during a disaster. This includes emergency patient care, communications, and data access. Data backup solutions, implementing robust data backup solutions that include regular backups of all critical patient and administrative data. So we want to ensure backups are stored in a secure and offsite location to prevent data loss. As we look at communication plans, develop clear communication plans that outline how to notify staff, patients, and external partners during a disaster. Include protocols for internal and external communications, as well as ensuring everyone is informed and coordinated. As we look at emergency power supplies, you also want to ensure that emergency power supplies are in place to maintain critical systems and lighting. As we look at regularly testing these systems to confirm that they are functional and sufficient for extended outages. As we talk about staff training and drills, train staff on their roles and responsibilities as part of this disaster recovery plan. We should conduct regular drills to ensure everyone knows what to do in various emergency situations, and collaboration with local authorities and hospitals. Collaborate with local emergency services and hospitals and other relevant organizations. Partnerships are vital for resource sharing and coordinated response efforts. So, as we look at review and updating the plan, regularly review and update the disaster recovery plan to incorporate new risk, updated technology, and changes in organizational structure for processes. And so this ensures plans remain relevant and effective. So, as we talk about recovery strategies, outlining specific recovery strategies to restore hardware, applications, and data in the shortest time possible, this minimizes downtime and service interruption. So, as we talk about post disaster review, after any disaster or drill, conduct a post event review to assess the effectiveness of the disaster recovery plan, and using this feedback to redefine and strengthen future responses. So, by having well prepared disaster recovery plans, we do not only ensure the continuity of care during emergencies, but also protect the integrity of our critical data and systems. And so, this readiness is essential for patient trust and safety. And as leaders, it is our responsibility to ensure that our healthcare facilities are prepared for any eventuality. And so let's take the proactive steps to strengthen our disaster recovery plans and demonstrating our commitment to patient safety and organizational resilience. And so, with our disaster recovery strategy set, we'll set the next focus on enhancing our regulatory compliance procedures to further safeguard our patients and align them with the best practices. So, as we talk about enhancing regulatory compliances is not just about adhering to the laws, but it's also about actively protecting our patients and ensuring that the highest standards of care are met. And so, as healthcare continues to evolve, so do the regulations that govern our practices. And so today we're going to look into strategies to enhance compliance procedures and ensuring that we do not meet but exceed regulatory expectations to safeguard our patients and our organizations. So let's look at measures to strengthen our regulatory compliance and maintain the highest standards of patient care. So as we look at continuous education and regulations, we want to provide ongoing education and updates to all staff on relevant healthcare regulations. And understanding these regulations are essential for compliance and should be an integral part of staff training programs. So as we look at regular compliance audits, you want to conduct regular internal audits to assess and ensure compliance with all regulatory requirements. And these audits help to identify potential areas of noncompliance and allow for timely correction. And an investment in compliance resources. We want to allocate adequate resources, including staff and technology, to support compliance activities. And so this may include investing in specialized compliance software or hiring dedicated compliance officers. And engagement with legal experts. We also want to work closely with legal experts to regularly review and interpret regulatory guidelines so that these expertise can be helped to navigate complex legal landscapes and implement necessary changes effectively. And so compliance and part of corporate culture. We embedded a culture of compliance within the organization by integrating its into corporate values and data practices. And as we look at compliance, compliance should be seen as everyone's responsibility, not just the one of the compliance departments. Effective reporting systems as well. They're important for implementing effective mechanisms for reporting compliance issues. And so ensuring these systems are easily accessible and to protect the constituent and safety of the whistleblowers. Um, as we look at proactive risk management, adopting a proactive approach to risk management by anticipating potential compliance issues and addressing them before they become problematic. And so, as we use data and audit outcomes to predict and mitigate risk, we also want to make sure that we examine policies and procedure management and to keep all compliance policies and procedures well documented and regularly updated. We want to ensure that these documents are accessible to all staff members and clearly communicated in their responsibilities. And so, looking at cross departmental compliance teams, which form cross departmental teams to foster a more integrated approach to compliance. These teams they can help to ensure that compliance strategies are consistently applied across all areas of the organization. And so, looking also at transparency within regulators, maintaining open, transparent relationships with regulating bodies. Regular communication can facilitate a better understanding of regulatory expectations, but also demonstrate the organizational's commitment to compliance. And so, by enhancing our regulatory compliance, we not only protect our organization from legal risk, but also build a safer and more trustworthy environment for our patients. Effective compliance is foundational to our mission of delivering excellence in healthcare. And so, as leaders, let us be diligent in our pursuit of excellence through compliance. We must lead by example in ensuring that our practices not only meet required standards, but also set new benchmarks for safety and efficacy in healthcare. And so, with a strong compliance framework in place, let's next explore how we can further innovate patient safety through technology advancements and creative problem solving. And so, as we look at innovations in patient safety through technology advancements, as healthcare professionals, our commitment in patient safety is continually renewed by technological advancements that enable us to provide better, safer, and more efficient care. And so today we're going to explore the latest innovations that are transforming patient safety in healthcare settings and how we can leverage these advancements to benefit our patients. So let's inspect several cutting edge technologies that are setting the new standards for safety in healthcare. Our artificial intelligence and machine learning utilize AI and machine learning algorithms to analyze vast amounts of healthcare data quickly and accurately. And these technologies can predict patient risk, optimize treatment plans, and enhance diagnostic precision, significantly reduce errors as well. And so, telemedicine and remote monitoring expand the use of telemedicine to provide continuous care and monitoring, especially for those patients that are in those rural and remote areas or those with mobility issues. Remote monitoring devices can alert healthcare providers to changes in patient conditions in real time, which allows for immediate interventions. And so I know that we talked about blockchain for health data security, but implementing blockchain technology to enhance the security and integrity of health data, blockchains can be used to ensure that patient records are tamper-proof and accessible by only authorized individuals, reducing the risk of data breaches. And then, robotic surgery and automation systems that provide greater precision, but also control during procedures and really minimizing surgical errors and improving patient outcomes. So, automation and medication dispensing and patient management can also reduce human error. And I believe we talked about wearable health technologies, but just to make sure that we covered that, I want to encourage the use of wearable health technologies that monitor patients' vital signs and collect health data continuously. And so these devices can provide early warning signs of deteriorating health conditions, and so enabling proactive care. And virtual reality for training, incorporating virtual reality systems into training programs to stimulate complex medical procedures and emergency situations. And VR training helps healthcare professionals advance their skills in a safe and controlled environment. So, as we talk about patient safety, I also want to emphasize the importance of enhancing infection control strategies. Infection control strategies also remains a cornerstone of patient safety, and especially in healthcare settings. And so, where the risk of infection can significantly impact patient outcomes, today we're going to discuss enhanced strategies for infection control that incorporate the latest practices and technologies to safeguard our patients and staff. And so we're going to explore advanced and effective infection control measures that are essential for maintaining a safe healthcare environment. Regular staff training, conducting ongoing training sessions for all healthcare workers on the latest infection control practices, including hand hygiene, proper use of personal protective equipment, PPE, and sterilization techniques. Advanced sterilization technology utilizes the latest technologies in sterilization, such as ultraviolet light systems and hydrogen peroxide vapor, to ensuring all medical equipment and environments are free of pathogens. And so, looking at antimicrobial surfaces, incorporate antimicrobial materials into high-tech surfaces such as doorknobs, bed rails, and workstations. These materials are designed to kill or inhibit the growth of bacteria, reducing the risk of healthcare's associated infections. Surveillance systems, implement robust surveillance systems to monitor and track infection rates within the facility. This data is crucial for identifying trends, potential outbreaks, and the effectiveness of current infection control measures. Isolation protocols, efforts enforce strict isolation protocols for patients with infectious diseases. These protocols should include dedicated rooms and equipment to prevent cross-contamination. Increasing the availability of hand hygiene stations throughout the facility, and also including alcohol-based hand rubs and sinks. Ensure that these are conveniently located and regularly maintained. And also patient and visitor education. Providing education to patients and visitors on the importance of infection control practices, such as hand washing and wearing masks. This education should be clear, accessible, and available in multiple languages. Environmental cleaning protocols, adopting enhanced cleaning protocols, especially for rooms and areas exposed to infectious agents. Using approved cleaning agents and techniques that are effective against a broad spectrum of pathogens. And as we look at ventilation improvements, upgrading ventilation systems to enhance air quality and reduce the risk of airborne diseases. Consider systems that incorporate HEPA filters and adequate air exchanges per hour. Looking at feedback and continuous improvement, establish feedback mechanisms for staff to report potential infection control issues and suggestions for improvement, and using this feedback to continuously update and redefine infection strategies. By implementing these advanced infection control strategies, we not only protect our patients and staff, but also enhance the overall quality of care in our facility. So, as effective infection control is fundamental to patient safety, it is an integral to our healthcare practices. So as leaders in healthcare, it is our responsibility to ensure that these infection control measures are not only implemented, but also a living part of our everyday practice. So let's lead by example and maintain the highest standards of cleanliness and safety. With a tremendous amount of infection control measures in place, let's now let's focus on finalizing our safety initiatives and discussing our strategies for ongoing improvement and evaluation. So, as we talk about a final review and ongoing improvement of safety initiatives, as we conclude our comprehensive review of safety initiatives, it's really crucial to emphasize the importance of ongoing improvement and evaluation. This final stage is not merely an end, but also a pivotal point where we can reflect and assess and plan for future advancements in patient safety. So, today we'll discuss how to effectively finalize our current safety initiatives and set the stage for continuous improvement. So, let's explore the steps necessary to ensure our safety initiatives are not only effective today, but continue to evolve as we respond to new challenges. So, as we look at a comprehensive review, regularly conduct comprehensive reviews of all staff and safety initiatives, assessing their effectiveness and efficiency and impact on patient outcomes. So use metrics and data collected to provide a clear analysis of successes and areas for improvement. As we look at stakeholder feedback, gather feedback from all stakeholders involved in safety initiatives, including healthcare staff, patients, and families. Their insights are invaluable for understanding the real world impact of our safety measures and identifying unforeseen issues. As we look at benchmarking against best practices, continuously benchmark our safety initiatives against industry best practices and standards. And this comparison helps to identify gaps and opportunities for adopting new methods and technologies that could enhance our safety protocols. Iterative processes, also an iterative process for safety initiatives where the outcomes of each review cycle inform the next set of actions. And so this approach will ensure that our safety measures are dynamic and adaptable for changing healthcare environments. As we look at training and education updates, you want to update training and education programs regularly to reflect the latest safety protocols, research findings, and technological advances. And keeping our staff well informed and well trained is crucial for the success and implementation of safety initiatives. Promoting a culture of safety, reinforcing a culture of safety within the organization by making everyone feel safety is is the organization's priority. And so encouraging open communication and non-punitive reporting and sharing responsibility for safety improvements. And always celebration of success and learning. Celebrate the success of our safety initiatives and equally learn openly for any shortcomings. Recognize both achievements and lessons learned motivates continuous participation and dedication to safety. And so throughout our ongoing review and improvement, our commitment to patient safety becomes a perpetual cycle of enhancement. And so each step we take builds on the last and driving us towards excellence in healthcare. So as we move forward, let's continue to champion these efforts and ensure that safety remains at the heart of all we do. And so together, we can achieve a safer and more effective healthcare system for everyone we serve. This concludes our detailed exploration of patient safety initiatives. So let's carry forward the insights and strategies discussed here to make lasting improvements in our healthcare services. So I want to thank all of you for your attentive participation today in today's discussion on patient safety. And so as we transition into the Q&A portion of our webinar, I look forward to addressing your questions and diving deeper into the topics that we've explored today. And so this session is your opportunity to clarify any points and seek further explanation or discuss challenges that you face in your practice. Your questions are essential as they enrich our conversation and help us all gain a more nuanced understanding of effective patient safety strategies. So please feel free to ask anything related to the subjects that we've covered, from technological integration and training enhancements to regulatory compliance and effective communication within healthcare settings. I will be responding to your questions directly, so bringing insights from my experience and the latest best practices in the field. So let's go ahead and get started. Please submit your questions now, and let's continue this important conversation. So the first question I see on the platform is, what are the most common challenges in implementing um, patient safety initiatives? And so I guess the most common challenge includes resistance to change among staff, limited resources, insufficient training, and the complexity of healthcare systems, which can hinder consistent implementation. The next question on the platform is, how can technology improve patient safety in hospitals? Well, technology, I believe, can enhance patient safety by improving record accuracy with electronic health records. And so providing real time patient monitoring systems and facilitating better communication among healthcare teams, and automating complex processes to reduce human error. That's a really good question. Thanks for asking. Um, the next question on the platform is, what role does leadership play in patient safety? So, leadership is crucial in fostering a culture of safety, allocating resources effectively, ensuring staff training, driving compliance with safety protocols. Strong leadership also supports open communication and continuous improvement in safety protocols. The next question is, can you provide examples of effective patient safety interventions? Effective interventions include the use of surgical checklists to prevent errors, implementing hand hygiene campaigns, using barcode medication administration systems to ensure that patients receive the correct medications, and conducting regular safety audits. The next question is, how do you measure the success of a patient safety program? That's a really good question. Um, Success can be measured through various metrics, such as reduction in the incident of adverse events, patient and staff satisfaction surveys, compliance rates with safety protocols, and even benchmarking against industry standards. What is the importance of patient engagement in safety initiatives? Patient engagement is vital because informed and involved patients are more likely to follow treatment plans, recognize potential errors, and also participate actively in their care, all of which contribute to a safer healthcare outcomes. How often should safety protocols be reviewed and updated? Safety protocols should be reviewed annually at a minimum, but also whenever new medical guidelines are published. Following the identification of a new safety issue or any major incident that suggests change is needed. So, what are some common barriers to effective communication in healthcare settings that can affect patient safety? That's a really good question. Thanks for asking. Um, I would say common barriers include hierarchical structures that discourage speaking up, language and cultural differences, perhaps interruptions during information exchanges, um, inadequate documentation systems. Um, how does staff training impact patient safety? We talked a lot about that in our presentation today, and ongoing staff training ensures that healthcare providers are aware of the latest safety protocols and can use the technology effectively and are prepared to handle unexpected situations. So, all of us, which all are directly impacting patient safety, and so I think we got time for one more question. What strategies can be employed to minimize medication errors? Strategies include using electronic prescribing, and so implementing double check systems and also educating patients about their medication and regular training for staff on medication practices. Um, and we have one more question. Can healthcare organizations handle safety complaints more effectively? Organizations should ensure that there are clear, confidential, and easy accessible channels for raising concerns and non retaliatory policies for those who file reports, and having a transparent process for investigating and responding to these complaints. What role is the healthcare informatics what is the role of healthcare informatics in patient safety? Healthcare informatics supports patient safety by facilitating the management of large amounts of data and providing support for clinical decisions and improving communication among care providers throughout integrated health information systems. How do you create a non punitive culture that encourages error reporting? Creating a non punitive cultures involves establishing trust that reporting errors will not lead to punitive consequences, but rather be a learning opportunity to improve systems and prevent occurrences. Another question is what are the best practices for conducting safety audits? Best practices include a standardized and transparent audit procedure involving a multidisciplinary team focusing on high risk areas and following up with auditing findings with concrete action plans. And our last question for today's discussion is, can you explain the importance of multidisciplinary teams in improving patient safety? Really great question. Thanks for asking. Multidisciplinary teams bring diverse expertise and perspectives, which are paramount for thorough analyzing safety issues, designing comprehensive interventions, and ensuring that all aspects of patient care are considered in safety protocols. So, as we talk about today's essential takeaways from enhancing patient safety, as we conclude our presentation, it's important to consolidate the critical insights we've gathered throughout our discussion on patient safety. And these key takeaways should serve as a guideline for principles and actions that point to driving our efforts forward and creating a safer healthcare environment for our patients and staff. And so let's highlight the core messages and strategies that that we should carry forward. And number one is culture of safety. Fostering a robust culture of safety that permeates every level of the organization, emphasizing that patient safety is priority in all of our operations and decisions. And number two, technology integration. We want to continue to embrace and integrate advanced technologies that enhance our patient safety through improved diagnostics, monitoring, and data analysis capabilities. Number three, interdisciplinary collaboration. Strengthening cross departmental collaboration to ensure that safety initiatives are comprehensive and inclusive, and drawing on diverse expertise from across the organization. Four, continuous education. Committing to ongoing education and training programs that keep all staff updated on the latest patient safety practices, technologies, and regulations. Number five is proactive risk management. So, implementing proactive risk management strategies that not only address current safety concerns, but also anticipate future challenges. And patient and family engagement, and enhancing patient and family engagement by actively involving them in the safety discussions, decisions, and evaluations, but also recognizing that they play a vital role in the safety process. And number seven, feedback and improvement. We discussed developing transparent mechanisms for feedback and reporting, encouraged open communication about safety issues without fear of reprisal. And number eight, regulatory compliance, maintaining strict adherence to all relevant healthcare regulations and standards, ensuring our practices not only meet but aim to exceed regulatory requirements. Number nine, regulatory safety audits. Conduct regular safety audits and reviews to assess the effectiveness of safety measures and make necessary adjustments based on these evaluations. And number 10, celebration of successes. Recognize and celebrate successes in patient safety, to acknowledge the hard work of our staff and to motivate continuous improvement in our safety practices. These key takeaways are fundamentals to our mission of providing safe and effective and compassionate care. And so each point represents a commitment to upholding the highest standards of patient safety and should be reflected in our daily practices. So let's leave today's session with uh, a renewed dedication to these principles and ready to implement and build on them in our respective roles. And so together we can achieve significant advancements in patient safety and ensure that our patients receive the best care possible. So as we conclude today's session, I wanted to encourage you to continue the conversation about enhancing patient safety in healthcare. And if you guys have any questions, comments, or concerns, and I want to ensure that you have my contact information. My name is Greg Wahlstrom, and I'm the President and Chief Executive Officer at the Healthcare Executive. My email is info@thehealthcareexecutive.net. You can also follow me on LinkedIn at linkedin.com/Greg Wahlstrom. You can follow me for insights and updates on healthcare management. In terms of availability, I'm available Monday through Friday from 9 a.m. to 5 p.m. Central Standard Time, and I am flexible and can accommodate alternative meetings to suit your schedule. Preferred communication, while email is my preferred method of communication, I am open to other channels that might better suit your needs. So as we talk about opportunities and collaboration, I'm eager to discuss professional collaborations, projects, or partnerships, or consulting opportunities related to patient safety. So I welcome any opportunity to work together and to enhance safety measures in healthcare. So please keep an eye out for upcoming events, talks, webinars, and workshops focused on patient safety. These will be excellent opportunities to deepen your knowledge and engage with leading safety practices. And for additional resources to further support your efforts in patient safety, I recommend the following resources. The Patient Safety Network, an invaluable resource for patient safety information, which offers a wide range of research articles, best practices, and news updates. Also, visit PSNet, which is the Institute for Healthcare Improvement, the IHI, which provides extensive training materials, toolkits, and case studies to help healthcare professionals uh, implement effective safety practices. Also, you can explore the IHI resources. The Joint Commission offers a wealth of guidelines and standards for patient safety that can help healthcare organizations maintain compliance and enhance quality care. The Joint Commission resources, also the World Health Organization, the WHO, um, patient safety is a global database of resources including guidelines, tools, and protocols on patient safety strategies from around the world. Patient Safety Resources, which is the Agency for Healthcare Research and Quality, the AHRQ, uh, which features tools and data and research to help healthcare providers work more effectively in their efforts to reduce medical errors and improve patient safety. Visit the AHRQ. Please utilize these resources to deepen your knowledge and enhance your practices in patient safety. So, thank you for your active participation and engagement today. Your insights and questions have significantly enriched our discussion, and I encourage you to reach out whether to follow up on a point from today's session or to explore new ideas related to patient safety. I'm here to engage and collaborate, and so thank you once again for your presence today. The Healthcare Executive is committed to supporting your journey towards excellence and patient safety. As we are excited to see the positive changes that you'll drive in your organization and the healthcare industry at large, please stay informed, stay connected, and continue to lead with commitment and safety. Wishing all of you the best in your endeavors to enhance patient safety. Please remember to like and share if you found today's session valuable. Copyright notice: this program, Strategic Leadership and Patient Safety, Transforming Healthcare Practices, is copywritten by the Healthcare Executive, 2024.